I have nuclear.
How can you change everything when I'm with you?
Because I
As
like.
long as it's not before, we
like
can
to mess
start
it up a
after,
little
but
bit.
as long as it's not.
Okay, we'll call this meeting to order. Could we please stand for the Pledge of Allegiance? I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everybody, for coming.
Good morning, Mr. Chair.
Good morning.
Good morning, everybody. Are there any additions or deletions to the agenda?
Not this time.
So moved, Mr. Chair.
Okay, we have a motion by Commissioner Jelinski, seconded
Are we
by,
missing the approval of the county board limits?
We will do that after
We
the
didn't do
agenda.
that yet.
I'll second that.
okay, we have a second by Commissioner Johnson.
Changed.
All in favor signify by saying aye.
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 Opposed, motion carries.
That's what he asked for.
Okay, we've got approval of the county board minutes from April 18th.
Okay.
We're gonna change that next.
Well, next, okay,
Yeah.
I would move on the board minutes.
Okay, we got a motion by Commissioner Johnson,
Second.
seconded by Commissioner Lemire. All in favor signify by saying aye.
Aye.
Okay, Deb, you wanna explain the revised minutes?
Yep, we have a revision for February 21st. The conditions that you approved and weren't written in the minutes, and we'd like to get those written in the minutes for a license that you approved, a permit that you approved. And there's also a clerical error on minutes that we want to correct also that was noticed regarding the call to order language, that it was cut and pasted from a previous meeting. So we'd like to change both of those from previous minutes.
So moved.
Got a motion by Commissioner Wincher, seconded by
Second.
Commissioner Johnson. Any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
That's it.
Okay, now do we need to approve the agenda as presented?
Nope, that we did.
Okay. Social service, vulnerable adults proclamation. Good morning.
Good morning.
Good morning.
Morning.
Good morning. I'm here today with the Community Adult Protection Team that meets monthly to review adult protection cases and community collaboration to help keep Morrison County safe and look out for individuals who may be elderly or disabled to try and be preventative and proactive against adult abuse. So I first would like everyone to introduce themselves.
I'm Bridget Yorick from Northern Pines Mental Health Services.
Jody Lucken, Morrison County Social Services.
Dana Potter, St. Otto's Care Center, Social Services.
Sergeant Investigator Jeremy Luberts, Morris County Sheriff's Office.
You know, I'd just like to say that this team has done a nice job of coming together, and it really shows how bringing community partners together, sitting at the table together, can really help our community as a whole, instead of each of us really being siloed and kind of doing our own thing. So it is just such a great thing that I appreciate all of you coming every month to be able to consult and bring us together to address this situation. Dana, if you'll read the proclamation for us.
Vulnerable Adult Abuse Awareness and Prevention Proclamation, Morrison County, Minnesota. Whereas people who are elderly or have disabilities had contributed to the general welfare of Morrison County by helping to preserve customs, convictions, and traditions of many people from diverse backgrounds. And whereas these residents are a vital and integral member of our society, their wisdom and experience have enriched our lives, and whereas abuse of the elderly and people with disabilities in domestic and institutional settings is a widespread problem, affecting hundreds of thousands of people across the country. And whereas suspected abuse was reported 187 times on Morrison County citizens who are elderly or have disabilities in 2016. And whereas abuse is grossly underreported because of the vulnerable adult population who are being abused find it very difficult to tell anyone and are usually ashamed and sometimes afraid. And whereas abuse happens to men and women of all income levels, all cultures and ethnic groups, whether they are in good health or incapacitated in some way, in neighborhoods and in rural areas. And whereas many of the cases investigated by Adult Protection Services in Morrison County involve self-neglect and financial exploitation, it is our duty as citizens to reach out to people in need. Now therefore, we, the Commissioners of Morrison County, do hereby proclaim the month of May 2017 to be Vulnerable Adult Abuse Awareness and Prevention Month in Morrison County, and urge all citizens to work together to help reduce abuse and neglect of adults who are elderly or have disabilities. Thank you.
I would so move on that, Mr. Chair, and thank you for all you do, for all of you.
We got a motion by Commissioner Johnson, seconded by Commissioner Lemire. Is there any further discussion?
Again, thank you again. It's a big responsibility you guys have, and I personally appreciate it, and I'm sure the rest of the people in the county do.
I too would also like to thank you. I'm a little concerned that there's 187 cases of vulnerable abuse within Morrison County. I get it, I mean, it's life, I understand it. But I'm anticipating that when we're talking about this, we're talking about abuse from all angles, whether it's physical, sexual, mental, whether it's financial. I mean, it could be a quadrillion different things that we're talking about, and that's too bad for everybody, and I understand that. So thank you very much for everything that you do. Appreciate it.
I'd like to thank you too for all you do. Thank you very much.
Thank you.
Okay, we have a motion and seconded. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Thank you.
Can we get a photo with the group?
Come on down, Mike, come on down.
Like this here?
Randy, Randy Winter.
Hi, Randy. I'm Bridget Urick.
I heard your name.
Do you want to hold this? They want this held up?
Why?
Well, because they want to see
Somebody's
that.
supposed to hold it.
Yeah, Jeff does.
What, like this?
Jeff does.
That's a good way to do it.
Jeff's in the center. There you go.
All right, ready? Very well done. 1, 2, 3. I'll take one more just in case somebody's.
Somebody had their eyes closed.
Yeah. 1, 2, 3. There we go. Thank you.
Beautiful.
Thank
Thank you.
you.
Thank you very much. Thank you all.
Next board meeting.
Okay, thank you.
Thanks, Matt.
Should I read this public hearing? Should I read all my public hearing stuff or do the liquor thing first
Do the liquor thing first.
and then do the public hearing?
Liquor thing will include a little bit of a.
Okay,
Chuck must be in the crowd somewhere.
next we're gonna have public health, notice of public hearing for liquor. Okay.
Commissioners, Deb?
Good morning, Katie.
Good morning, Katie.
All right. Can't see this, hold on. So, Minnesota statute 340A 405 talks about intoxicating liquor off-sale licenses. I'm just gonna read the small area that pertains to what we're doing today. So no license may be issued under the subdivision unless a public hearing is held on the issuance of the license. Notice must be given to all interested parties and to any city located within 3 miles of the premises proposed to be licensed. We did put a notice in the paper 2 weeks before the public hearing. At the hearing, the county board shall consider testimony and exhibits presented by interested parties and may base its decision to issue or deny a license upon the nature of the business to be conducted and its impact upon any municipality, the character and reputation of the applicant, and the property of location. Any hearing held under this paragraph is not subject to Chapter 14. So what you're seeing is what was put in the paper. Is this the Route 26? Mm-hmm. So there's two today. Route 26, it was former the Morel Bar in Morel, located at 32992 Nature Road. It has been purchased by Belinda Club Hockey and renamed to Route 26 Bar and Grill. The applicant has applied for on-sales liquor license, Sunday sales, and requests to obtain the off-sales liquor license. The public hearing is just for the off-sale liquor license. However, the request for the board is for all of those. The bar has been closed since October 2015, and because of this lapse in licensing, a public hearing is required by the statute I just talked about for new off-sale licenses. Again, this is just the off-sale part of it, but the applicant has applied for the on-sale Sunday and then also for food beverage license and tobacco license. So all of those things will be approved by the board, but the public hearing is for the off-sale.
Okay.
All right, the next, do we do both or one at a time?
One at a time,
Yeah.
I would say.
Okay.
Okay, then let's have the public hearing. Let's have the public hearing for the off-sale liquor license. Why don't I read through what we normally do in a public hearing, because we have 2 or 3 of them today and the rules will apply to all. The meeting guidelines. The main purpose of the meeting is to obtain citizens' input about whatever we're referring to. This will be the liquor license. To facilitate the process and to make sure that everyone who wishes to speak has an opportunity to do so, the commissioners ask that the following rules apply. If you wish to speak, raise your hand. After the chairman recognizes you, you may move to the microphone. All persons wishing to be heard must come to the microphone. They must give the complete name and address. The board asks you to limit your comments to no more than 3 minutes. After 3 minutes, the board chair will ask you to wrap things up and bring your comments to a close. If the view of the groups are being expressed, one spokesman is asked to speak as the group representative. All comments must be addressed to the county board and all questions must be directed to the board chair. Speakers may use specific examples to illustrate their point of view, but without an opportunity to review all information, staff may not be prepared to answer all questions. Questions or comments from the audience are not allowed without having been acknowledged by the board chair. The board reserves the right to question any speakers regarding their comments. The board also reserves the right to question staff regarding the comments made at the public hearing. At the conclusion of all testimonies, the public hearing will be closed. These guidelines are intended to outline the process preserved in order to give everyone the opportunity to speak. The commissioner asks the opinion of everyone be treated with respect. No interruptions, please. Everyone who wishes to speak will have an opportunity to do so. Only testimonies or questions relating to the relevant topic will be discussed. All other comments will be referred to the appropriate agencies or departments.
Thank you.
Yes. Okay, now, first of all, does the board have any questions about this liquor license?
You know, Mr. Chair, I have one. It used to be Morrell Bar and Grill.
Correct.
That just was the name of it.
Yep.
Okay. That's my only question.
I'd like to add one more thing I forgot. The liquor license was approved by the sheriff and the county attorney. So
Okay.
it does go through several channels before it gets here.
Okay. So now I will ask for public comment. I have to ask 3 times, and if nothing's said, then we'll close the public comments on this hearing. Are there any questions to this liquor license? Are there any questions or comments to this liquor license? Are there any questions or comments to this liquor license? If none, the public part is closed. Could I get a motion to accept?
I'll make a motion for more discussion.
Okay, we got a motion by Commissioner Winchester,
I'll second
seconded
it.
by Commissioner Johnson. Any further discussion?
Question I have, what's the hours gonna be on this? Is this gonna be 1 o'clock or 2 o'clock? Do we know that?
I never heard the 2 o'clock close.
I don't know the specific answer to that question, but I can find out.
Go ahead.
It's 1 o'clock.
1 o'clock? Okay. We'll take care of it right away, so we know.
Thank you.
Okay.
Mr. Chair?
Yes.
Just for the sake of argument, Morrell is, what do we call Morrell, the city? What's the word? Unincorporated city?
Yeah.
Because the license doesn't go through the city, it goes through the county. That's just, so I just want to make
It's
that,
in our township. It's not even a city, it's more of a city.
it's just the location?
If it's not a city, then the
Right.
county board needs to.
That's just how it
approve
works, that's all I'm
That's how it
clarifying.
works.
Okay, very good.
Okay, we have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed, motion carries. Thank you. Okay, you got another one too,
I do
right?
have another one, yeah.
Okay.
So the second one is Rice Creek Hunting and Recreation. It's located at 16543 Game Farm Road in Little Falls. The game farm has been operating in Morrison County for many years. Over the years, the recreation facility has been a game farm for pheasant and duck hunting. It's now expanded to include sporting clays, gun fairs, youth gun safety, and more. More recently, the game farm has been a popular venue for weddings and other celebrations. So Rice Creek is wanting to provide an off-sale liquor service for their customers. Again, the public hearing is for off-sale licenses.
Okay, then we'll move back to the public hearing. I'm gonna ask 3 times if there's any comments. Are there any comments from the public on Rice Creek? Are there any public comments on Rice Creek? Are there any public comments on Rice Creek? If none, the public hearing is closed. Can I get a motion to accept Rice Creek's?
I'll make a motion.
Got a motion by Commissioner Jelinski, seconded by Commissioner Lemire. Is there any further discussion?
Mr. Chair, I would just like to also add that recently, Public Health held a responsible beverage server training, and I'm certainly not gonna say the entire staff from Rice Creek, but I'm gonna say a good share of their staff was at that training. That's just a comment to go along with the whole thing here.
And also, the sheriff and the county attorney have approved this liquor license as well.
Okay, all right, any other comment? If not, we have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed, motion carries. Thank you.
Thank you.
Okay, next we've got Public Works.
Thank you, Katie.
Thank you.
Ordinance and variance application. It's a public hearing too. Welcome.
Good morning.
Good morning, Faith.
Good morning, Mr. Chairman, members of the board. Always good to be here on a sunny day.
Always good to have you.
Yes. It's always nice to see your smiling face.
And he always
Thank you
brightens
very
up the
much.
room.
You said that out in the hall, didn't
Mr. Chairman, members of the board, we are here today to consider a variance request by Faye Dietrich to conduct a demolition, type 1, and of several structures and silos on a site that exceeds the capacities that we allow within the Morrison County Solid Waste Ordinance. And so that's one of the variances that are being requested. The second being our ordinance is written so that typically when a variance is issued, you work towards coming into compliance with the ordinance over time. And so you continue to, we continue to look at the variance if it was granted under certain circumstances. Under this circumstance, once this, if it is approved, we would anticipate that Ms. Dietrich would not have to come back in, that the variance would be permanent, and that what she's requesting to do here would be allowed. Chuck has conducted his inspections, and he'll review the staff report so that we can try to answer any of your questions beforehand, and then if there's anything afterwards, we'll try to accommodate that. I did include a map so that you have a concept on where the location of this would take place. If you want to move to the staff report, Chuck, that would be the next thing.
Good morning, commissioners, staff.
Good morning.
Good morning.
This is the staff report for the Morrison County Solid Waste Ordinance variance application for Faye Dietrich. And this is to establish essentially a demolition debris type 1 facility under the permit by rule allowance. And this property is located at 31193 183rd Street, and that's Piers, Minnesota. So the variance is to exceed a 500 cubic yard threshold for type permit by rule type 1 demolition facility within Morrison County. Firstly, the final site does need to be established. However, there is a general description that she provided on where she'd like to do that. The proposed site does meet all the other compliance requirements that would be required by the Minnesota Pollution Control Agency and their permit by rule application. There was the inspection made, as previously mentioned. We did that on April 10th. And during that site visit, there were, the county level has criteria for demolition and disposal of debris. So under that inspection, there were a number of considerations that came together, and the directors told you about those. It's the 500 cubic yard threshold allowed for type 1 demolition. In this case, our demolition facility type 1 is a demolition debris disposal facility which is designed to hold and does hold less than 500 cubic yards of demolition debris. So during that inspection, did some general measurements and looked at what would the proposed project would, and based on some of the information provided by the potential contractor, by Ms. Diedrich, the proposed project would exceed that 500 cubic yards readily. So we did investigate a couple different options. There are a couple other permits that are available, but either way, it would have required some sort of action be taken on the 500 cubic yard threshold. So at that point, we did discuss where we are today, the request for a variance application that was made on April 21st. So the provisions for establishing a PBR type 1 demolition facility in the proximity to the site have all met our qualifications with the exception of that criteria, the criteria of the Pollution Control Agency as well. And as going through this ordinance, there was also a requirement in the ordinance that would require that the variance shall not be granted for a period in excess of 2 years. So in this case, the proposed project the intent was to do the facility and close it, and that would be the end of the facility at that point. So to be coming in for every 2 years, as directors talked about, would probably not be as required as may have been the case if it was a continuous demolition facility, and it would be an ongoing operation, and that hasn't been proposed as the case. That is really the staff report at this point. Are there any other questions or concerns or issues I can address at this time with the board?
If I may, Mr. Chair, again, in one of your comments here, it says, from the Department of Assessment, the demolition debris from the Dietrich, if I pronounced that correctly, proposal is acceptable demolition debris. Could you tell me what the demolition is going to be? Like, is it silos, barns?
In this case, there are 3 different silos. 2 of them are the same size, a little larger. The older structure is they're both, I can't remember the name of how they built them, but they're concrete, but they use those panels essentially in the bands. So I was assuming a little bit that there'd also be, the iron would be extracted and some of those things, so that wouldn't be in there. But essentially, you're talking about wood debris, concrete, and the roofing material, so asphalt roofing material. I can't really think of anything else either, so no creosote or anything would be allowed in there.
Mr. Chair?
Yes.
Just as a point of clarification for myself, if for no other reason, are we talking about digging a hole, or are we talking about bringing this stuff to the landfill?
Digging a hole on her property.
On site, at the end of the day, it's all done, just, we're gonna now have a flat area, if you will, that, guess what, there's something underneath? That's what we're talking about. Just wanna make sure that I'm on the right, okay.
I had talked to Fay, and I want to just discuss a few things with our ordinance and stuff. Fay had brought to my attention that the county allows 500 cubic yards. State allows 15,000 cubic yards. We do this so that we don't have landfills all over the place, correct? More or less? That's why we're at 500 cubic yards?
Essentially, when the ordinance was established, it was it was something that was debated extensively. And the 500 cubic yards really was established so that the type of situation that Fay is proposing could happen, where you want to knock an old barn down on site, but the county board at that time did not want to establish this where by permit, by rule, you could establish your own demolition debris landfill within the county, and there isn't anything we could say about it. And so the 500 cubic yards really came into play based on typically maybe one big barn going down, something like that on site. In this situation, there's several structures in the silos, which then push it into above what that capacity was. But it's really the same kind of materials that we would allow under the type 1 demolition debris that we allow under our ordinance. We'd be able to do this on our own without bringing it here if it was just a little bit smaller.
If it was smaller? Well, and I think that's a good way to do this, that we can tear down some. If there's too much, they have to bring it to the board. The part that I thought was unique about this, and explain that, I'll try to explain it, but there's a 60-cent tax per cubic yard.
Chuck would,
Yes, there is.
And what's curious to me was that pertains, if they haul it to the landfill, the state gets 60 cents per cubic yard, or if they bury it, the state gets 60 cents per cubic yard. So the state's gonna get their tax regardless of where this stuff goes. I just thought that was kinda unique in this policy, you know, so I wanted to bring it to everybody's attention.
just can't hide from them.
Where there's a will, there's a way, obviously.
Well, interestingly enough, this 60 cents really hasn't been raised since, I think, the early 80s. I mean, so if there's
Perhaps
any.
we don't want to say it too loud.
Yes.
Exactly.
Yeah.
Interestingly enough, you would have thought maybe they might have done something over the years, but I guess they've kept it stable. But yes, they get the money regardless. And what happens after this, if approved variance, it will go and be, there is an application that goes to the agency that details this information. She will also do another demolition notification at that time, so she notifies the state of the demolition first, and then along with that, that application has already been submitted essentially for the demolition debris facility. She will receive a letter that so states that in the letter establishes that that fee is still out there. There are some post-closure requirements, some other things long-term that essentially they agree to when they establish the facility.
And we'll probably see some more of these. You know, there's a lot of old barns out there that are just sitting empty now, and people will probably start tearing some of them down with new structures coming, so. Okay, is there any other questions for these folks? If not, we have a public hearing open again. I'm gonna ask for comments 3 times, and then we'll close the public hearing. Are there any comments on this demolition? Are there any comments on this demolition? Are there any comments on this demolition? If none, the public hearing will be closed.
Mr. Chairman, also the department did not receive any comments since advertising.
Okay, thank you. All right, could I get a motion to accept this as presented?
So moved, Mr. Chair.
Okay, got a motion by Commissioner Lemire, seconded by Commissioner Johnson. Is there any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Thank you.
Thank you very much.
Okay.
Okay, next
Have a good day. Thank you very
We won't
much.
have you
Thank
speak so much next time. Thank you, guys.
Thank you.
Okay, next we have Hands of Hope report.
Good morning, Steph. How are you?
I'm good, how are you?
Wonderful. Thank you very much.
Introduction's not required, or?
Not on my behalf.
I would like you to introduce yourself.
Stephanie Ock, Executive Director for Hands of Hope Resource Center. And a lot of times when we come before the board, we're doing a proclamation or something, and today it's just a conversation about who we are and what we do. And so I'll just kind of give you, in a nutshell, information about us, and then you can ask whatever questions that you have after that. So we're a nonprofit organization. We serve Morrison and Todd County, both. We provide services to domestic violence, sexual assault, child abuse, and general crime victims. So that includes, for example, with child abuse, it also includes children who have been exposed to domestic violence in their home. So that's a little bit different than maybe the statute for child abuse, an expansion of it a little bit. With sexual assault, we also work with sexual exploited victims as well as sex trafficked victims. We do have some in our area that we've provided services to. And then also general crime, just expand on that a little bit, that would be any other type of crime, such as assault, fraud, theft, survivors of homicide, those types of crimes. In the last year, just to give you an idea of the number of victims that we've worked with, let's see, I wrote it in here somewhere. We have served this is just in Morrison County now, we served 210 victims of domestic violence, both male and female, those are adult victims, as well as 141 children living in their homes, and 44 concerned friends and relatives we call secondary victims. So sometimes when we're providing services, we have a friend come in with them or a family member who's concerned about them and wants to help them get services. We served 72 victims of sexual assault. 42 of them were adults and 30 of them were children, as well as 35 concerned others. 182 victims of general crime and 25 concerned friends and family members. And then the children that we served under domestic violence and sexual assault, to not duplicate them, we served an additional 33 children under our child abuse area that were victims of physical abuse, emotional abuse, or like dating violence, those types of things in there. So that's just a little bit about the number of people that we've served. I wanted to just give some brochures out. We've had brochures for a long time and you've probably seen them. We made a change to them in the last 6 months, which actually I really like. Our brochure in the past has indicated, like, this is what domestic violence is, this is what sexual assault is, whatever, which is helpful to a degree, but it wasn't really necessarily as helpful to the clients that we serve, so we made a change, and so the brochure now is very specific about the types of services that we provide. And so it kind of breaks down what it is exactly that we can do to help someone. So a lot of what we do is crisis intervention services. We do have a 24-hour hotline that people can call. We don't get a lot of calls on there, believe it or not. I mean, it's a nice option, and there are some people that take advantage of that. But most of the clients that we serve actually are walk-ins into our office looking for help with, a lot of times, a harassment restraining order or an order for protection, or they've been injured and then there are criminal charges, and so sometimes they have questions about that process. We go with people to court to help explain the process to them. Work very closely with the county attorney's office with that, law enforcement. We meet clients sometimes at the hospital if they've been either sexually or physically assaulted and they are injured. A lot of times we'll get called over there to provide some services to them and start the process right away. We have a little bit of financial, some grants that we wrote, smaller grants, to be able to give some financial help to people. So if someone has the need to have their locks changed, or if they have the need to, maybe they need to move to get out of an abusive situation and they just really can't afford their first month's rent or a damaged deposit, sometimes we can help with those types of things. I don't know, that's kind of it in a nutshell. We do have safe housing, emergency safe housing, which is short-term, up to 7 days. We don't have a shelter here. We have shelters in Brainerd and St. Cloud, and those are for more long-term situations. Where we would use safe housing would be if someone, for example, there's been a domestic situation in someone's home and the person takes off and law enforcement is looking for them to arrest them. Sometimes we can help by putting someone in safe housing so that they have somewhere to be while law enforcement's looking to make an arrest. That would be an example of an appropriate use of safe housing. So, as far as let me just back up a minute. So the majority of what we do really is about advocacy with clients, but our mission really talks about advocating for victims, educating the community, and then making some societal changes. So making the system better or in a way that works to support victims instead of re-victimizing them. So we do go out and do presentations to the community. We try to do information into the school system, especially, just to kind of have a little prevention focus. Unfortunately, a lot of the money that we get for providing services comes from the state, and, well, unfortunately, fortunately, however you want to look at it, it's good. But it really focuses on direct services. So 90% of the money that we get from the state, which is a grant of like $380,000, has to be used on direct services. The unfortunate part of it is we can't use it to do the education piece, and so we've been writing grants and doing some things to try to bring in more money so that we can continue to focus on the schools. Because it's really good to go out there and talk about, this is what healthy relationships look like, these are the things that are concerning, and this is where you can get help. And so we continue to try to do that. We also go out to civic groups and churches and you name it. Anyone that wants us to come in and talk about any of the issues that we work on, we'll go out and talk about specifics about what that means. You know, what is fraud? For example, we did some things with the banks. Or we went out and we got a grant from Medica and went out and did some training for medical professionals at St. Gabriel's Hospital in the clinic, Lakewood and Staples, which serves the Staples-Motley area, and then the Long Prairie Hospital, to look at how do you ask the questions of victims coming in or people coming in. How do you ask them if they feel safe in their home? What's the right way to do it? what are the resources out there for helping them if they disclose that they have been abused and some of those types of things. So we're always trying to look at how do you identify victims and how do you serve them once they've been identified. So we have 11 board members. That governs our agency. We have 11 volunteers that have been trained to take call on our crisis line, so we do utilize volunteers. As I said before, the majority of our funding comes from the state. We do have contract services through Morrison County Social Services. That funds part of us. We have United Way money through Morrison County. That's the majority of what we have. We have a grant right now through St. Gabriel's Hospital to work on the Violence Prevention Initiative. That money will be going away at the end of June. And they are focusing on other things. And so we're looking for some education money, and we've written some grants to be able to continue to do that outreach and awareness piece. And then a lot of the other ways that we're funded is through fundraising, which historically we've done a golf tournament. We aren't doing that this year. We're looking at what our next plan is, and we have some things in the works, but we're not really sure what we're going to do with that yet. And we write a lot of small grants, and so there's a lot of good places out there like the electric co-ops and the community foundations and places that are willing to give a little bit here, a little bit there, and we use those for specific projects that we are trying to fund. Questions for me? I tried to give a broad overview of kind of
I'm gonna
what
go
we do.
first this time, so I don't have to say I agree
Sure.
with the rest of them. I wanna thank you very much for all you do. When people come to you, you don't judge whether this is true or not true.
No.
You send them to the right agencies and stuff to get help, correct? Is
Right.
that kinda
Right.
how things work?
Yep.
Okay.
We do. I mean, we don't investigate at all, so we take what they say to us as truth. If we find out somewhere in the process that someone else comes forward that is the actual victim, like maybe we all of a sudden have a conversation with law enforcement or someone else and find out something different, then we will set a boundary there and just let them know that we can't assist them any further with
Okay.
what's happened. Doesn't happen too often. I mean, usually when people come in, it doesn't happen as often as people think that
Yeah.
someone would make something up to like get a one-up in a divorce, or, I mean, there's lots of myths out there about why people false report, but we don't see that as often.
Okay, well, thank you.
Mr. Chair,
Yes.
I've always said Hands of Hope does a lot with a little. My daughter used to work there, and I know, so thank you for all you do. What you deal with, like I say, you do a lot with a little, so thank you.
And Mr. Chair, I would comment, I sit on that board, the Hands of Hope board. The truth of the matter is that Hands of Hope is, I really hate to say this, but one of the best kept secrets that there are. And you're not secret, I don't mean that at all, the way it came
I
out.
do know what you mean.
Nobody needs you until they need you. And once they need you, you are such an important cog to that gear. There just are no words to explain because of what you deal with, and it's confidentiality. It goes from the confidentiality of a domestic situation, whatever it might be, to how you're gonna fund it. So, I mean, you wear about 17 different hats, and I'm aware of that, because I also know that you are constantly looking for a financial grant, a financial anything, a donation from anyone. And I'm very well aware that there are many volunteers that work with and for, if you will, Hands of Hope. So truly, honest to goodness, thank you very much.
So just to comment on your comment, Jeff, I think it's true. I'm surprised sometimes at the number of people that come in and say, I didn't even know that you existed. Because I do think we have a lot of information out there, but I don't think people see it until they actually need it. Or they have someone that comes to them saying, this is where you should go, they helped me one time.
Yeah.
And most of our referrals come from friends, family, some of the systems we work with, county attorney, law enforcement, those types of things. But we also have sometimes, we just had one the other day, someone came forward and said, I heard about you when I was in school,
Yep.
So it makes a difference. Sometimes it kind of sits in someone's brain there for a long time and they don't think they're ever gonna need it, and then something happens and they do. But
Well, I'm glad you're there for anyone that needs the services that you provide.
thank you.
If I may, Mr. Chair, when you say serve, you do not go out into the household or like that. So if I call and, and I say, hey, I need some help, you're not gonna send somebody from your office, switch you office out of the old courthouse.
Right.
But, So you don't do that, you'll refer them to the correct area they need to go, correct?
Thank you for saying that. We don't. I mean, there's a safety issue potentially for us, so we don't send our advocates and volunteers out into the homes. Most people come to us in our office, or if we meet someone, a lot of times it's meeting with them at the county attorney's office, or meeting with them at the hospital, or social services, or, wherever it is that they need us to meet, but it would only be a more public place like that. We wouldn't go to someone's home.
All right, thank you.
Well, thank you. Does anybody have anything else? If not, I thank you very much.
Great,
Thank you
Thanks,
for having me.
Steph.
Appreciate it.
Appreciate your time, Steph.
Thank you for all your support.
Yes.
Thank you. Okay, next we'll have South Country. Good morning, Leota. If you would introduce yourself and your guest.
Good morning, Commissioners. I'm Leota Lynn, the CEO with South Country Health Alliance, and along with me today is our CFO, Scott Shuffman.
Good morning.
Good morning.
Scott is actually going to do the bulk of the presentation to you today. I'm going to take a little reprieve. But what we wanted to share with you today is to just provide background, share with you our 2016 financial results, a little bit about our 2017 budget and where we're at now, and some of the initiatives that we have underway to address the financial aspect.
Great, thank you. So I'll refer to this up here. We wanted to start with our year end. If we go to the next slide, we did complete our financial audit. We are audited by Clifton Larson Allen is our external audit, and we completed that with no misstatements, no audit adjustments, and a favorable opinion. South Country has had a long history of clean, cooperative audits with their auditors, and we certainly want that to continue. 2016 was no exception, so a very good situation there. In terms of our year-end results, and I'll expand on these a little bit, we did have a net loss for the period ending 12/31/16 of $10.2 million. That included a substantial premium deficiency reserve that was established for anticipated continued losses in the current year, 2017. As you can see, second from the bottom there, that was $7 million that was set up in anticipation of ongoing losses, primarily in our government assistance program in Minnesota Care and PMAP, prepaid medical assistance. Without that premium deficiency reserve, we would have had a net operating loss of $5.3 million.
Mr. Chair, Scott, do you want to explain what that premium deficiency
Yes.
reserve is and why it's there?
Yeah, basically, this is the second year in a row. What we're required to do as a health care organization is if we believe the premiums that we'll receive on the businesses are inadequate to cover the anticipated claim volume that we have on that book of business, and we can reasonably estimate what that difference is, we're required to set up basically a pre-funded reserve to fund those losses. In 2015, at the end of the year, we set up one of those such reserves of just short of $1.9 million for anticipated losses in 16. And you can see that up there coming in as a positive in 16. When we reassess what things look like for 17, we established a similar reserve at the end of 16 of $7 million for anticipated losses in 17. So that comes through as a negative in 16. It'll come through as a positive each month in 2017 to offset those anticipated losses.
And when we use the term premium, it's really referring to the capitation that we receive from the Department of Human Services or the Center for Medicare and Medicaid Services. So it's our capitation rates.
Yeah, it's one of those items that's pretty specific in what it's called, premium deficiency reserve. So basically, why you're setting it up is you're assuming your premiums are going to be deficient and unable to cover those anticipated claims.
And Mr. Chair, just as a reminder, we only, as South Country, serve government-funded clients. So we don't set premiums based upon what we're going to need to have, like a private insurance company. This is the money that the state says this is what you're going to get, and we anticipate it's not going to be enough based upon the claims coming in.
Yeah, and I'll show you a little bit more detail. We do have state and federal programs, Medicaid and Medicare. Many of our programs do generate a surplus. Primarily two in the Medicaid arena that have been generating significant losses, not only for us, but basically anybody in the government healthcare business in Minnesota. It's been a tough couple of years. Just a very high-level summary. We did have revenue of $242 million last year. Our claim expenses were about $224 million, about $10 million unfavorable to budget. And what we've seen, not only anticipated shortfall in premiums, but 2016 had a pretty significant increase in those underlying claim expenses for our members, primarily medical costs. We actually saw some favorability in some of our other claims like pharmacy and chiropractic benefits where we were favorable to budget. Medical costs, depending on the category you looked at, saw increases last year of 9 to 13%. And again, this was something consistent across those programs in the state, not just for South Country. So healthcare organizations look at a loss ratio. Basically, we divide our claim expenses by that revenue. And for South Country, we finished the year at 92.4%, about 2% unfavorable to budget. What does that exactly mean? What that means is for every $100 we have coming in as capitation revenue, we paid out $92.40 worth of claims. So leaving very little margin for running the business, administrative expenses, et cetera. Again, I mentioned the premium deficiency reserve that was established in 16 for 17. One of the highlights we had last year was on our administrative expenses. We did manage to finish the year about $850,000 favorable to budget. So our administrative expenses represented 9.8% of our revenue. Staff did a very good job in a tough year really watching those budgets, not only for staffing, but business-related costs to operate the organization. And so we were able to at least partially offset some of those losses in a tough year. I'd just like to touch base on the balance sheet, statement of financial position, a couple key items here for healthcare organization. What was our cash position? This is at 12/31, just short of $55 million. Obviously, we have a lot of cash. We come in, we get paid to serve these members, and then we turn around and pay claims for these members. And so that represents what our claim costs are going to be for the next several months. We finished the year at a capital and surplus of $20.4 million. You can see that was down about that $10 million from a year ago due to the operating loss that we had. Fortunately, South Country had built up pretty significant reserves and was able to withstand a year like that and finish still at a favorable position for the end of the year. We're measured by the state on what's called a risk-based capital ratio with a regulatory requirement of 200%. Even with this difficult year, we finished the year at 223%, or about $2.1 million excess to that regulatory requirement. So again, having those reserves, we were able to weather the storm, so to speak, over the last couple of years.
And Mr. Chair, I think some of us have experienced that insurance business is one that's not as stable as we normally like to be in government. And so it's something that we need to pay attention to, and I appreciate the fact that we are prepared and hopefully can do things to minimize any of that in the future, because it takes up years, it takes down years with insurance. You never know what you're going to get with claims.
Right. In the 15 years of existence, I think there was an operating surplus in 10 of those, when the last two have been negative. This is just a quick view by product. I won't spend a lot of detail in here, but just to show you there. Minnesota and PMAP, I mentioned those. Those are our two biggest programs. We have by far the most members in that PMAP line of business, prepaid medical assistance. And you can see what those losses were even prior to the establishment of that reserve for next year. And we set that reserve up in the lines of business that we expect to see continued losses. But the big thing at the bottom there is that loss ratio. We talked about that overall for the business was about 92.4%. You can see on Minnesota Care, it's actually over 100%. So for every $100 we have coming in on Minnesota Care, we're paying out $103 in claims. And that's before we even pay staff and so forth to, serve those members. PMAP, while having a fairly significant net margin there of $5 million, that's the bulk of our business. Loss ratio there at 95+% is too high. And of course, most of our administrative expenses get allocated to that line because that's where most of our members are. So again, we finish at a pretty significant net loss there, and then you add in the fact that we took that prepaid charge, if you will, for 2017. It is true that a number of our programs do generate a surplus, so I'd like to show those, the remaining Minnesota programs there, our MSC Plus and our 2 SMBC products, generating, pretty decent returns there, and not coincidentally, you see loss ratios there much more reasonable. For a healthcare organization, we'd like to see a loss ratio in that 85% range, 90 tops, and these are performing really well on that measure. And then finally, our federal programs, our Medicaid programs, kind of a mixed bag there. Our Senior Care Complete product used to be called MSHO. We generate a pretty decent surplus there, $1.7 million. And then Ability Care, which is an important program to our portfolio, we do have some ongoing losses there, a loss ratio of about 100%, but that is a dramatic improvement over the past several years. And it's a line of business that we are looking at this year, try and add some additional membership in there. It's been fairly static, and so we'd have somewhat of a closed book of business there, and so we'd like to diversify and spread that risk out a little bit. We're not going to grow it dramatically, but we'd like to grow it by a couple hundred lives if we could, and see if that helps spread out some of those risks.
Excuse me, but do these losses have anything to do with what the state changed? Was it a year ago where other organizations were involved in this?
Absolutely. The rates, or the deficiency that we're seeing in the rates, is really a direct result of that competitive bidding process that happened in 2015. Medica was the low bidder in that process. Subsequently, you've seen that they're exiting the market because they've identified that the rates were insufficient. In 2017, we're continuing to see some impact of that because the base rates for 2015, driven by that competitive bidding process, are still being used as part of the basis for establishing the rates for 17. And we'll talk a little bit later about what we're anticipating for 18.
Going forward. Yep.
Okay.
Mr. Chair, we tried to, in our attempts, explain that we're different than the Medica, and so don't put us in the same basket and treat us with the same rules. And while "and I told you so" isn't exactly appropriate, but Medica is no longer in the business. We're different than what they are, and so it's an interesting process.
I guess what I'm kind of getting at, it looks like we're losing a lot of money, which we are, but a lot of it doesn't have anything to do with what you've done. Legislation's changed and things made everything different. Am I correct on that?
To the most extent, yes.
Okay.
I wouldn't say that we aren't responsible for anything. There's always the opportunity to look at where are the opportunities to improve, to find efficiencies. But the main drivers were the deficiency in the rates, and then a tremendous increase in the trend of medical expenses. And as Scott indicated, we've seen that across the market. You may have recalled a news article that was released a number of weeks ago that the large nonprofit health plans that do government programs in Minnesota posted a combined loss of $350 million for 2016. So we're not the anomaly. We're seeing this type of financial performance across the industry in Minnesota.
Thank you.
The state thought they could, the company proposed a bid that was less expensive, so that's how the state set the rates, and we're all paid at that lower rate. Well, it doesn't cover the cost. We just don't have another line of business to help offset that. Medica saw that and they pulled out, and
Where does the state look at responsible bids, I guess? We do that with buildings and everything else. I mean, just because they were lowest bid and now they're gonna go out of business and they wanna pull out, but now you have to work with that. It doesn't make a lot of sense to me.
Yeah, there's some rules that govern, bids are reviewed by the federal government. Federal government pays the state to administer these programs. Those rules are being tightened somewhat with some new actuarial standards around, the recoverability, actuarial soundness of those rates. So we will see what level of impact that has on that rate-setting process. What we do know is the state has communicated, they are shortening the base period for setting rates. They previously used 2 years of experience. And then also, they're going to be using as recent experience as they can, given the timing of the process. The issue we had going into the 16 was, setting the 17 rates, is the 16 experience that we saw and everybody else saw with these increasing trends was not used to set the 2017 rates. They still used 14 and 15, which historically was a very low point in the cost per member. We believe, at least in part due to with the Affordable Care Act coming in, people changing plans, some people maybe not even realizing what insurance they had. We think we saw an artificial low, if you will, in some of those programs, and yet we continue to use those as the base period for setting future rates. That will change for 18, where we at least will be going, as we've been told, July 1st of 15 through mid-16 as the basis for setting next year's rates. There's still quite a big delay because of the process and all the work that needs to be done, but it will include a fairly significant portion where we did see some of those underlying increases. So I like to use cautiously optimistic. That is the basis of the rates. There's a lot of things you can do to those in terms of adjustments and so forth, but we feel going into the process that we're better set than we have been for a couple of years.
Mr. Chair, if I may, when we talk about the state, I just want to see if we can't clarify this.
Yes.
State's a pretty big place. Who are we talking about? I think I know. Are we talking about DHS?
Yes,
the
correct.
Department of
Human Services.
Human Services?
Yes.
And is it DHS that is actually the ones, if we wish to point a finger at, are the ones that accepted the low ball bids and the low ball rates? Is that a fair statement even? I don't know if it is.
Correct.
They run the
Again,
procurement process,
Yep,
yes.
but it was checked and it was looked at.
Well,
It's really, the data that they were looking at was
Yeah.
data that's, it could be better and it could be more accurately,
Okay.
it could be more current. It's
Okay.
probably the best rate to reflect what exactly is happening more in the here and now versus those other
Okay.
time periods.
But again, when we're talking the state, we're talking the Department of Human Services.
That's correct.
Thank you.
And we will be starting the contracting process earlier this year. That's been being moved forward. So we'll actually have our first all-plan sessions with the Department of Human Services in July, with our individual contracting sessions scheduled for August. So I believe that there is a high probability that by fall, we will know what our rates are for 2018, and that will be very helpful to have that for the budgeting process. Over the last several years, it's been considerably later.
I have one comment. I've sat on that board a few years now, and Leota's down at the Capitol, and, at first, South Country Health Alliance, who was it? Nobody really knew. She's been at the Capitol, and she's at DHS pretty often these days, and you're getting pretty well known down there now. That South Country, what good things it does, so.
I still don't quite understand how, when you had such a bad year, and they want to use that same formula to bring into the next year. All you do is fall behind. That makes absolutely no sense.
The
unless
state
you're
wants that
government.
because it's better for the budget that they have.
Yeah, but that's beside the point.
Oh, I agree.
know, I
And it's
agree.
one of
just-
those
it's not
where,
right.
where an organization like ours, the reason we're involved in that is the local delivery, the control that we have, the ability to
Yes,
sit around the table
absolutely.
with our peers in these other counties to make decisions that impact better health, and we can react quicker. We're not looking to make a lot of money. We're not looking to, we just want to be able to serve clients and have the costs covered. And so that's what we try to do and work with the state, and it's a year-by-year education that we get.
Let's look at our budget for this year that was approved. I go on the next slide there. I think I covered those points
Okay.
in the past one. We do have an approved budget here for 2017 of an operating loss of $1.3 million. And I'll talk a little bit about some things we have designed to reduce that gap. And that obviously includes the $7 million that we set up prior year to help offset those losses. We did have to formulate a new budget this year because of the Medica transition. We'll go to the next page. So what happened there? Well, Medica's leaving the business, or I can say past tense now. Medica left the business as of May 1st. This is a slide that will give you some more recent numbers on those that Leota will have. But basically, we expected after a negotiating process to take on the Medica membership in the counties that we're in. And so we expected to get somewhere between 5,500 and 6,000 additional memberships in PMAP on May 1st, and we did do that. And then we also got some increases in our default assignment in both programs for the year going forward. That should bring in additional several hundred members.
Excuse me for 1
Yes.
second, please, Mr. Chair. When we're talking about, sorry, I just lost the insurance, Medica.
Yes.
Did we have folks in Morrison County that were under Medica?
Yes.
So as of May 1st, they have nothing.
As of May 1st, they are now South Country Health Alliance
Okay, they
members.
just moved automatically.
Correct.
Thank you.
Correct.
Sorry for
Yes.
the interruption.
No problem.
And if I may, Mr. Chair, like 2 years ago, we lost a lot of members due to Medica, correct?
Correct.
So now those members are coming back to South Country.
Some of them, yes.
Yes.
Some of them. So what else? Well, they got choices. other
Some will
choices.
be new members.
Right, okay.
Some will be new, and Leota will talk about, we are going back to a single plan status in a number of counties, and she'll update you on that. So with the additional revenue here, we do get additional claims on those members. We're expecting a net positive margin there of about $1.1 million. And then we do have some increased expenses for handling claim adjudication and claim processing for those members of about $700,000. So we had to adjust our budget for this, but we expect a small net positive from that Medica membership.
And that's good.
That's a good thing. I've talked about budget opportunities, and even though we have an approved loss, we have several items that are designed to reduce that gap. As a management team, we'd like that $1.3 million budgeted loss to actually be zero or better. We've got a couple of projects on the revenue side that are funded, additional work that our actuarial group, as an outside firm, doing for us to help improve our risk scores, to make sure that we're capturing all of the relevant diagnosis codes on our lines of business. It determines in some part how we get paid. For individuals that are less healthy, we should receive a higher payment for them. And one way to ensure that is to have the most accurate and timely risk scores. So we have a project to CMS being the federal side, DHS being the state side, to maximize the revenue on those programs. Our actuaries have estimated that that could be worth $750,000 on the low side. We have the expenses for doing that project in our budget. We do not have the anticipated benefit from that project in our budget. So we think that alone could go a long way to help reduce that gap. Additionally, we want to focus on medical costs. We've always done coordination of benefit work. That's ensuring that if there's other insurance involved, whether that be another carrier where we're secondary, a car accident where it could be the car policy, that the right insurance company is paying those claims. We also do utilization management to look for trends, usages, and could be durable medical equipment, whatever the case may be, looking at the data and trying to identify other opportunities we could have more early intervention, et cetera. We have a new database and some additional tools that will allow us in both of these areas, we think, to do a better job of peeling that onion back and getting at some of that underlying data to help us do a better job in both of those categories and reduce those medical claim costs. A new task initiative this year, our medical director has formed a provider-based work group, including some members of some of our largest providers, to do very similar work to that I just mentioned, sharing data on our membership with them, bringing them to the table and seeing what trends are you seeing in your systems, and really problem solving is how can we do a better job of reducing total cost of care for our members. And we've had very good feedback from groups to basically say this is something they want to help with, and they're very pleased to see South Country at the table asking to lead some of those initiatives. And then lastly, as we did last year, be a good steward with our administrative expense budget. We're certainly always looking to reduce that. We did a good job of that last year, coming in under budget, and we expect to try and do the same thing this year. So combination of getting the revenue that we should be paid on our members, controlling those costs as best we can in the medical area, and in our own shop, making sure we're being good stewards with the dollars of our administrative budget. We think we can close that gap and not have a deficit this year. Lastly, how are we doing so far in 2017? Again, I won't go into great detail here, but our March results for the first quarter, we have a loss through 3 months of $864,000. We had a budget, which I don't show on here, for the first quarter of about a $650,000 loss, so we're a little bit higher than what we expected. Again, on a loss ratio basis, we're within 0.3% of what our budget is. 3 months is a pretty short period of time, so in that respect, I don't think that necessarily makes a trend. A couple things I would mention. Our March results do not have any Medica members in yet. That comes May 1st. The other thing that is significant is, as part of bringing our budget for this year down, we started last fall a project to go out to our providers and look for some provider rate reductions across our entire portfolio. And we were very successful in doing that. We still have about 3 of our major providers where we're still in negotiations. We expect that to close pretty soon. But we expect to save upwards of $3 million on provider rate adjustments in 2017. Those rate adjustments don't kick in largely until the second quarter. And the majority of those, somewhere between April 1st and July 1st, is when those reductions will go into play. Those will start to lower our medical costs going forward. No benefit from those reductions are in these first quarter results. So those are 2 things where we expect, and you can see our budget for the last 9 months of the year is less than our expected loss for the first 3 months of the year for one of those things being the provider rate adjustment. So basically, long story short, we're pretty close to budget 3 months into it. We haven't seen any weird spikes that were concerning, and we think things are pretty much aligned with where we expected to be.
So as we look at the issue of Medica, they did depart the market on May 1st. Those members transitioned to South Country Health Alliance. So for the PMAP, the Prepaid Medical Assistance, this is the medical assistance program for individuals under age 65. The numbers that you see in the counties were the Medica enrollment in those counties as of April. So we anticipated that we would have about 5,815 members that would come into South Country on May 1st. We did just receive our May enrollment, and so the actual enrollment across the 7 counties, we returned to a single plan status in 7 of our 11 counties. The actual new enrollment was 5,874. So in Morrison County, 1,056 members that previously were either enrolled with Medica or are new as of May 1st enrolled with South Country. So it was a 26% increase in our enrollment in Morrison County. When we look at the Minnesota Care, which is the next page, there still continues to be 2 plans. It's required under federal regulation. So where you now see UCare as a plan choice, they replaced Medica as the second plan in each of our counties. The other thing that did change with this, though, is we will now receive the default assignment. So when a member is determined eligible for medical assistance and eligible for managed care enrollment, they're provided information about their plan options and given the opportunity to select a plan. If they do not exercise that right to select a plan, the state automatically puts them into a plan, and going forward, the state will put them in South Country Health Alliance.
So, Leota, Mr. Chair, if I may, if you had 100 people, is there a magic number? 85% of them are, and say, hey, who do I get? And I get you. I mean, is there a magic?
The number that, I don't know that there's a firm number. The estimates that we've been given by the Department of Human Services is that approximately 30% of members, 20 to 30% of members
Don't care.
do not make a plan selection and are defaulted.
Thank you. good enough.
So this is where our enrollment was actually higher. We actually had 744 new members into Minnesota Care, so that was higher than what we anticipated. In Morrison County, 111 members, so a 23% increase.
Excuse me, but is Minnesota Care what used to be U Care?
No, Minnesota Care is the program that is for individuals who maybe are employed, but they don't have access to health care coverage through their employer and are lower income, so they pay a premium to the state to be able to have coverage through the Minnesota Care program.
Okay, and was U Care a private organization, or did they work with the?
UCare does government programs.
But
They're an
didn't they go-
insurance
But
company.
didn't they go out of business when this
They
whole
were-
thing happened?
They were removed from the counties in the 2015 competitive procurement, and Medica got business across the state. Now, when Medica exited the market, the Department of Human Services went back to UCare and offered them an opportunity to come back into the market.
Okay.
So,
Yeah, really.
Because that rule's still existing, that we need to have two options,
options.
instead
Right,
of
no, I
just
understand.
saying, like it used to be, that you can have one option, that's a, well, proven to be stable, consistent option, but
Yes.
I'll keep that as well.
So, a higher than projected estimate of new enrollees, and I think in the long run, we hope that that will be a positive. The last several pieces, I'm not gonna spend a lot of time on this, but, you know, as we've already talked about, the last year and this year, we know are gonna be very financially challenging years. There's an element of it that we don't have a lot of control over. We do what we can to influence the rate-setting process with the department, making sure that we're providing accurate information to be used for that process, but at a certain point, we don't have control. So we have a responsibility to really look at those things that we can control and manage. And so for this next couple of years, it's really looking at focusing on those elements that we can. We know that we took some hit to our reserves because of these couple of financial years, so we really need to work towards rebuilding those reserve levels. Fortunately, we had them to work through this. It's a different situation than we were in a number of years ago when we had some losses, so that's a positive. So we have 3 goals over the next couple of years to really look at achieving that medical loss ratio. We've set some targets of bringing it down to 90% for this year, 88 for 2018, and 85 for 2019. These will be stretch goals. These will be challenging goals for us to meet, but really looking at all of those opportunities, as Scott talked about, that we're looking at making sure that we're maximizing our revenue, being paid appropriately based on the health status of our members, making sure that we're doing those coordination of benefit activities, and then really looking at how do we manage those healthcare claims expenses. We did unfortunately need to do some provider rate reductions. It's not the route that we would prefer to go. And as we've had those conversations with our providers, we know that we can't just take it all from our providers. They can't sustain it either. And so that really is that place where we're coming to the table with our providers and saying, how do we work together to impact reducing these medical claims expenses? It's not about just putting a lot of prior authorizations in place and saying, no, you can't have access to service. It's looking about how do we work together, avoid duplication, improve those levels of care coordination to really impact the healthcare outcomes for our members. We'll continue to focus on our administrative expenses, looking for those opportunities to do things more efficiently, more effectively. Again, how can we streamline some things to impact those costs? And then really focusing on our workforce. Our workforce is our biggest asset. And so really making sure that we're doing those things to retain and recruit a skilled workforce that can help us accomplish the work of our mission. You know, Deb has made the comment that we are different. Our model is different. It really is about how do we interact in our communities, how do we partner and collaborate with our counties, public health, social services, our providers. And it really is a very member-focused organization. And I think a piece that really hit home to me, and Scotty hasn't even aware of this, is I had been out of the office for a couple days and I came in and I checked my mail yesterday. And I had a thank you card in the mail. And we had a member in Morrison County that unfortunately passed away. And we received a thank you card from the family saying, thank you for your care and concern and your help with all of the issues at our mom's journey's end. That is why we do what we do, and I think that truly indicates the impact that we have in our members' lives and in our communities.
Very good.
You don't see that every day,
No.
right?
I don't know that Blue Cross Blue Shield gets that many.
Yeah,
We don't know.
Does anybody have any other questions from the audience?
Great.
Thank you, well done.
Thank you.
information.
Appreciate
Thanks,
your
both of you.
support.
Appreciate
Thank
it.
you so much.
I want to thank you very much. I know I'm an alternate on South Country Health Alliance Board, but Dwayne always comes, so I'm not allowed to be there.
You are more than welcome.
Anytime.
Don't listen to
He never misses, so thank you much.
Thank you, Commissioner.
Thanks.
Thank you.
Thank you.
Hold on.
I've been thinking maybe at 2 minutes.
Yeah, I was gonna say, should we do the award first?
Oh, I don't.
Yes.
Okay, yeah, let's do the social service. Brad, we got an award to present?
Yes.
We'll take a 5-minute break.
So I'm going to call Melanie and Julie up. This is a proud moment for Morrison County. It was a few years ago that we took this naive college graduate from North Dakota and brought her to central Minnesota. And
Couple of years ago.
just a couple.
Yeah, just a
couple.
few, just a few.
And so one of our employees was honored by the University of Minnesota Center for Advanced Studies in Child Welfare. And so I'm gonna turn over to Melanie, who actually did the nomination, and just talk a little bit about why she did it and what she said, and then I'll let Julia say a few words.
Thank you. I decided I wanted to nominate Julia for this award with the University of Minnesota because she has been with county for 31 years. And 15 of those years she's been working in adoption. When I started at the county a long time ago, she told me that she had the easy job doing licensing and she didn't have to do that hard stuff. Well, about 15 years in, then she was asked to do some of the more challenging work with state boards, and she gladly takes that on. She gladly takes on many challenges, working with relatives to get their home studies completed. And the situations that she manages with state wards are sometimes one of the most very difficult and heart-wrenching. So we have older state wards that she's going to pick up in another state in the middle of the night and all over the place. So I'm going to dance shows or what, you name it, that she gives of her time and of herself to that. In addition to that, she provides great leadership in our agency on the juvenile treatment screening team, which is a very important screening team where we make decisions about placement and permanency, and so she's a vital member of that. So she just gives so much, and she provides so much leadership to so many staff in our agency. I really thought that she deserved this award, and I was thrilled to find out that they agreed.
I'm very humbled and honored to be receiving this award. I had a nice group of people, including Deb and Brad and Mel, and some other coworkers and family members with me at TCF Bank Stadium when they presented me with this. There were two other recipients, 3 total, that received this. I don't know, should we pass that around just so they can see it?
That's impressive.
So, thank you. Yeah, Morrison County has been a great place to work. When I first interviewed for the job, I thought, I'll stay in Little Falls for a couple of years and then I'll move on, but I've never even really considered applying anywhere else because this is a great place to work. I have great managers, I have great coworkers, and there's great people in this community for me to license and to have as adoptive families for the kids that we serve. So tomorrow is my 90th adoption in court. Today was 89, so I feel proud about that.
Mr. Chair, we had a great field trip. It was fun. We packed the van full, and many of the Child Protection, Melanie's group came and was there to recognize Julia, and I was proud to be asked to do that. And it never ceases to amaze me. I can have the worst day at work, and then I can walk over and see what we have so many dedicated people doing every day that takes my stress and puts it to shame, because the work that they do impacts so greatly for the families that they serve, for the kids that they serve, and they do it with a smile on their face, and they have fun still and learn how to be able to cope with that. It overwhelms me. I'm impressed all the time with the work that they do, and we're so lucky to have staff like Julia and
Thank
the
you.
rest of the team that do it every day. So. it was
And I've
fun.
known Julia for 27 years, and she is the same person today as she was 27 years ago, which is great when you talk about the work that we do, because it can be stressful, it can be very trying at times, and
Yeah.
so.
There can be tears shed.
Congratulations.
Thank you so much. Thank you.
And if I may, Mr. Chair, I remember working with my wife and I, that was probably 31 years ago.
Yeah, I was a newbie.
And again,
Yeah.
you haven't changed.
Oh, thank you.
Congratulations.
Thank you very
Keep
much.
up the good work.
Okay, I will. Not ready to retire yet.
Even though we're putting Julia in the basement.
I had to tease these guys a little bit at the ceremony about 31 years in an office, private office with a window on the main floor, going to the basement in a cubicle with no window.
Yes, she was kind enough to call out.
You're still sticking.
I'm still staying.
She was kind enough to call out, and Deb Gruber's putting me in the basement with nothing. It was lovely.
It was all in fun.
I know, it was, and just a great group, it really is, and Julia is a major part of that, so we're lucky here in Morrison.
We just want to keep you, that's why we put you down there.
Tell you about the change yet.
Yes, right.
Chained to the desk.
So we would like a picture with Julie and the board, and then we do have a press release that will go out to the paper after today, and hopefully the record will be kind enough to print it along with the picture with the board, so.
Yeah. Well, and
And
we
her
have
work.
some photos from that
Yeah.
day too, that we'll maybe use some of those too, but it was wonderful.
All right.
So, for it.
So I think you can go behind we'll just let you be.
We've got a
Yeah,
spot.
and-
Really, we should
Or
probably
maybe, should we stand for
Yeah,
this?
this
I
one.
think we
Oh,
need to
we need to stand.
Yeah, I think so.
We need to stand.
Yes,
We need a
I
break.
appreciate that. The chairs.
Chairs?
So will you send that?
Where would you like to take the
Right in here is good. Silly picture.
And probably one other one.
Right in the
I don't
middle.
think I have any others.
I'll
Brian,
send you one.
would you mind just
Oh. Get out of the way, please.
excuse us?
I don't want to cover you guys up.
Okay.
Maybe I will.
Mind just staying just, I can, there. Very nice. You know, I don't know that I can get much better, but I'll try. Come on. Oh, perfect.
Thank you. Thank you very much.
Thank you.
Thank you, Julie and
And
Mel.
thanks for sticking around. even-
Yes.
Vulnerable adults abuse report's gonna go first because she needs to get to Brainerd.
Thank you, Mr. Chair, appreciate that. So, in honor of Vulnerable Adult Awareness Month, I thought it would be good just to give you a snapshot of the activities within the Vulnerable Adult Unit, and so I asked Penny to put together a little information. She's probably just gonna talk about the graphs, but the first page or two is more about how the program operates. So I'm just gonna have her go straight to the graphs.
Okay. So as we heard in the proclamation, we had 187 reports of suspected abuse that came into Morrison County in 2016, which is up from 139 reports that we received in 2015. You know, looking at this number, that's a fairly significant increase. I have to wonder if the MARC system that was implemented in the summer of 2015, so we're at the 2-year anniversary this summer, had any impact on that.
Penny, can
Yes.
you explain the MARC system right off the bat?
Yes, absolutely.
Please.
So it is a statewide system, Colin, that takes all adult protection reports now. Those calls no longer come to individual counties. They go to the state system that takes the report, and then the state system sends them off to the appropriate county or lead agency for investigation and screening.
And really, that system made a lot of sense for this particular population because a lot of reports that counties received were not the responsibility of counties as a lead investigative agency. They were the responsibility of the Department of Health or the Department of Human Services, which license facilities. And so, and statewide, they've seen a dramatic increase in reports because of the statewide call-in center. So But again, it made sense for that because a lot of the reports are about nursing homes, group homes, assisted living facilities. And so that's why they moved to a statewide reporting system for vulnerable adults.
So then, is the vast majority of our calls, would you anticipate, and I don't know that you have data for this, would you anticipate would be coming from a you or from a me reporting the vulnerable actions that have taken place? It's probably not the vulnerable person that's making the report, or is it often? I
No,
don't think so.
it typically is either a mandated reporter, so
Okay.
a professional who is per statute required
Yep.
to report any suspected or observed abuse, or family members.
Okay.
A lot of the times, it's those individuals, those professionals working with elderly adults in their homes who have seen things that are of concern to them.
Thank you.
So I would speculate that we see that dramatic increase because not only that mark system, but also, we continue to work within our community to reduce that stigma on reporting. We continue to have our intake worker, Sarah Pratt, go out and complete mandated reporting trainings with different community agencies and entities throughout Morrison County. So I don't think that it's a bad thing that we're seeing that number. I'd like to have them reported so that we can take a look at them. If you look at the next graphs, when we say refer to current work group, those are cases where they may have a case manager in place already and it's a self-neglect situation. So that case manager will go ahead and work with that individual instead of adding an additional person into their lives. The other agency responsible, that's what Brad was talking about, those typically are screened right out and we don't see them, but there are a few that we need to bounce back to a different agency to screen and investigate. Screened in for investigation, this correlates with, we had an increased number of reports, so we screened in proportionally more reports to investigate. And then screened out reports. The next 4 pie graphs show our percentage of screened in versus screened out. And we did see an increase in 2016 versus 2015, 2014. I would speculate that some of that is because the mark system is able to take the information of the reporter, but not ask any further questions. When we were getting those calls directly at our agency, we had a fabulous worker who was asking all of the questions so we could gather as much information as possible to make a fully educated and understanded decision about whether it needed to be screened in for investigation or not. Right now, we screen in a number of reports just to gather more information because the only person during screening that we can talk to is the reporter themselves. If they have a case manager, we can't talk with them. If they're working with somebody in public health, we can't talk with them unless we open an investigation and screen it in. So I would anticipate continuing to see more screens in just so we can get information that we need.
Am I looking at that right? Already in 2017, we've nearly equaled what we did in 2015. We're on a record-setting pace.
So this is just giving you the proportion of how many are screened out versus how many are screened in with the total number. So if you look at that first chart,
Yeah.
we have 54 reports that we have already received from January to May 1.
Okay.
Out of those 54 reports, 13% of them were screened in.
Thank you.
Mhm.
We're definitely on pace for more calls
Thank you.
and
Yep,
more reports.
absolutely.
Not so much in the screen in yet, so.
Thank you.
And then the last graph just shows you, of those that were screened in and investigated, here are the results of what happened. You can see there is an enormous increase in the number of false ones for 2016. And again, I think that really relates back to we screened them in because we didn't have enough information to determine if they were a VA, determine the story behind the report. So we screened them in. Once we got into that investigation, we were able to find that it was false.
And we And as the Minnesota Adult Reporting System improves the staffing and the training of those who are taking the calls, I think the quality of the reports continue to improve as you talk about what they need to hear, what they need to ask, those types of things. And so hopefully as we move forward, the system continues to improve.
And we have already seen it improving. They are consistently working on that. They're continuing to gain information from us as lead agencies about what we need in that system. So it is a collaborative effort to continue to make it better.
And again, this is a month where we talk about this, and I think it's important to remember, these are usually our parents, the older adults, generally living independently, maybe taking advantage of by family, friends, neighbors. You know, I know the sheriff does a good job of putting out public information around scams that tend to target older folks who don't understand maybe what they're getting into or what they're accepting. And so I think it's just important, especially for family members, to make sure they're helping with their parents and helping them manage when they can, so.
Sounds good, thank you.
Yeah.
Does anybody have any
Thank you.
questions?
Thank you.
Thank you.
Thank you very
Drive
much.
safely.
Drive safe, yes.
All right, the last thing that I have on the agenda is back down there a little bit, and that is a request for a resolution for Morrison County to be the host county for a National Joint Powers Alliance Innovation Grant. We are submitting a grant on behalf of the Region 5 County Social Service and Public Health Agencies, attempting to become a more trauma-informed organization. This is a partnership with all 5 counties where we would work with an organization that's competent in creating trauma-informed organizations. And this is about really changing the practice, the policies of an organization to support individuals who have experienced trauma. And in the grant application, usually speaking, there is about 51% of the population that has experienced some type of trauma that walks through our door. It could be natural disaster, it could be family issues, it could be child abuse, it could be vulnerable adult abuse. Just a variety of individuals within the community who have had some form of trauma that we are trying to support. Part of the grant also is supporting our staff who are listening to some of these stories over and over again. And so we're really pleased that the National Joint Powers Alliance out of Staples allows counties to do innovative opportunities by applying for these grants. And so as a lead agency applying for this grant, we need a resolution from the governing board, which is our county board, to allow us to submit this application. So I'm here today requesting that resolution, which is on the second page. There would be no county costs if we were successful in receiving this grant. However, there would be in-kind contributions because staff would be participating in trainings, support, those kinds of things. So the request is to allow us to apply for this, and I believe the application was for $95,000.
So moved.
Second.
I got a motion by Commissioner Wincher, seconded by Commissioner Lemire. Is there any other discussion?
Mr. Chair, I fully support this. However, I have to ask Brad the question. Your staff's pretty busy. Are you gonna have time to pull this off? Or is your staff gonna have time to pull this off? Is your staff gonna have time to do the in-kind in this? As I said, I support this, but it comes with a little bit of a cost, whether we like it or not. It's not, maybe, we're not paying it out, but it comes with a cost. Let's be honest about it.
Do they have time? Probably not.
Okay.
However, I think that us as directors realize the importance of this
Okay.
activity. And so I think it's then realigning the priorities around what staff are being trained on, because we all have some expectations of continuing education. This will be a large undertaking if we're successful, because it is changing the culture. It is creating some structure so that we can support staff in the work they do. But I think it's then realigning the priorities around training and education for our staff if we're successful.
Okay, that's all I needed to hear. Thank you.
Any other questions? If not, I thank you very much.
Think we have a motion.
Oh, I'm
You may
sorry.
wanna
I'm
abstain,
sorry.
just because you're chair.
Yep. I have a motion, a second. All in favor signify by saying aye.
Aye.
Opposed, I'll abstain from it because I'm on the board.
Thank you.
Thank you.
Very good, thank you, Brad.
Thanks, Brad.
Thank you.
So I can scan it and send it in.
Okay, next, MCIT is not here yet, so we'll do public health.
Well, how about, you don't have land services either, here, hold on a second.
We're gonna do public health, right?
Yeah.
Yep.
Yep. Or is that, does land service need to be here for that?
Nope.
Okay. Welcome, Katie.
Hello again.
Hello, Katie.
Sorry to
grab
see your resignation.
Yeah. So I have to ask a question before we start. What was voted on at the public hearing?
Was the off-sale license.
Because in one of the RBAs, the description was on-sale, off-sale, and Sunday liquor license application.
Oh,
And that was for
yeah.
Route 26, so
The
was,
one was Rice Creek was just the off-sale, the other
Yep.
one had the off-sale and the other components.
so those were voted on.
That's, I would consider that approved, I think that's what we were, the
Yes.
RB in front. Thank you for
And we
clarification.
voted on those because they're new at the public hearing, right?
Well, one is
No.
a new off-sale license,
Yeah.
but due to the gap in that license of the Morrow establishment,
Yeah.
the off-sale requires that public hearing. But not all components require the public hearing, just the off-sale.
Okay.
But we did vote on more than just the
Yes,
off-sale
yep, the
for
RBA we.
the Route 26.
Yes.
Right,
Okay.
because the other one's new, even though it's, because they were closed down.
Yes.
Yeah.
So I just want to make sure.
So
Go
where are
back
you at
one.
here, one more? Sorry, I had to jump.
No, it's okay. I just have to make sure what we have. There's quite a few things today.
Oh,
Okay,
the MCA then,
perfect.
yeah, all right.
Okay, so the first is to approve the transfer of a liquor license, and this is on, off, and Sunday sales from Western Liquors. It's from one owner to another owner, so it's from Robert Boyd to Patrick Kalmbach.
Western Liquors, that's in Cushing, right?
Correct.
Do you want these, Mr. Chair, all in one motion,
So-
or do you want them?
I can.
We can do them all as one if that's legal to do that.
It's, why don't we just take them separate, because they're on
Okay.
separate RBAs right now, would be easiest
Okay.
right now.
This was approved by the sheriff and the county attorney.
Okay.
I'll make a motion to approve, Mr. Chair.
Second.
Got a motion by Commissioner Lemire, seconded by Commissioner Wincher. Any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Okay, so the next, these are food, beverage, and lodging. So to approve a new owner establishment license, and one we just talked about was for Western Liquors. And then the second one is for the Route 26 bar, Belinda Club Hockey, which we had talked about before in the public hearing.
So moved.
Okay,
Second.
we got a motion
I
by Commissioner.
apologize.
Go ahead.
There's more on there, sorry. And then there's a seasonal establishment license, and you'll see there Dairy Treat, Pine Grove Zoo, Ridge.
But I thought we were doing them
Yeah.
one at a time.
So this is all on one, and these are all food, beverage, and lodging.
They're different types of licenses.
this is all
So we
food
clump the
and-
licenses together, so
Just
this
because
is.
it's a bar doesn't mean it's drink.
Sorry.
This is food.
Exactly.
So there's
it's-
alcohol, there's food, beverage, and lodging, and then there's tobacco, and then within those, there can be different licenses,
Okay.
like
Yes.
Very
new
good.
owners and all that.
Why is one more expensive than the other, if I may ask, for 687 versus 515?
Are you looking at the top?
Yeah.
Some of it's prorated, some of, for Western Liquors, has been closed for a few years, so
Right.
that's having to pay that new license. The other one is,
Also closed for a few years.
No.
That was for 2 months.
some of them are prorated, some of them,
So maybe the timing of
Just
the
a
sale.
question, and I just, so.
some of them can be prorated, and it can be for, they can have different things within the license.
But they are paying the same.
Yes, they're all
throughout.
paying off of the approved fee schedule
okay.
from the
That's
commissioners.
good enough.
I still want to clarify something in my own head. The first one we did, Western Liquor, is because it's a liquor license. New owner, off-sale with new ownership, right? And the other ones that we're gonna do together is because it's a food license.
So the first one was the transfer of a liquor license, the second one is a food, beverage, and lodging license.
Okay, okay. But we're
But
putting
it's
all
called
the-
Western Liquors, and that's probably why it's getting confused.
Okay, all right. But we're doing all these together,
So
the Dairy
this-
Treat and,
So
This
there's no
RBA
motion
is,
yet either.
this RBA is food, beverage, and lodging, the one previous was alcohol.
It's okay to do all the food, beverage and lodging all together, which is what we would typically do.
My mistake, I didn't follow it. I thought
It's
we were-
confusing, there's a lot of
No,
things
that's
here
fine.
today.
I just want clarification.
And there's
that's
some
all.
notes on the bottom there. So the two notes on the bottom are from the public hearing.
Yeah.
So they were voted on this morning and were approved.
Okay. So now,
So this RBA, unless you have further questions, should be good.
okay,
Also is going to include the Dairy Tree, Pine Grove Zoo, the Ridge Rib and Steakhouse in Motley.
And those are seasonal.
And with that
licenses
being said, I'll
every year.
make the motion.
I'll second it.
okay, we got a motion by Commissioner Jelinski, seconded by Commissioner Johnson. Is there any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Okay, and the last one is tobacco. So we had alcohol, then food, beverage, lodging, now we have tobacco.
Okay,
And those are for the Western Liquors and Route 26, what we've been talking about.
okay, can I get a motion?
So moved.
Okay, we got a motion, we got a motion by Commissioner Lemire, seconded by Commissioner Wincher. Is there any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Sorry about the confusion.
No, that's fine.
Not a
We
problem.
just need to,
All right,
Thank you.
thank you.
thank you very
Keeping us
much.
honest, I like it.
Okay, land services report. Amy?
Good morning.
Morning, Miss Amy.
Amy.
I have a couple things for you today. The first one is consideration of the plat of M&M Edition per recommendation of the Morrison County Planning Commission. Public hearing on this was held on April 24th, 2017. I believe you were all present at that meeting. So now I'm bringing this to you for final approval.
Could I get a motion?
I would so move on that.
Got a motion by Commissioner Johnson, seconded by Commissioner Lemire. Is there any further discussion?
Mr. Chair, you gotta remind me which one this was. I'm looking at a map here, but I'm not,
As far as the parcel?
yeah,
Or
what are we talking about here? Is
it's
this up by,
parcel,
up
and then
north
it's
on the
being
golf course?
No,
No.
no.
You-
This is out Piers Way. This is in,
That was Kenny Meyer.
Oh, I remember.
yep, this is a
Yep,
one
yep,
lot.
I remember.
This is a one lot
Yep,
subdivision.
very good. That's,
Yep.
With the river.
yep,
Yep.
yep,
Yep.
absolutely. I got it.
I know what he's talking about, though. He was thinking of the one with the plots up by the
We're seeing
lake.
a few more plats coming through than we
Absolutely,
have
I got
had,
it.
so.
Thank you.
Okay, we have a motion, we have a second, right?
Yep.
Okay, is there any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right, thank you. And then I've got Julie here to bring forward the abatements, property tax abatements.
Good morning, Julie.
Good morning, how are you guys?
Wonderful.
Good. Okay, well, this one's a pretty simple one. We're just seeking approval for an abatement where the homestead was removed in error. We need to just get it back to the property owners, so we're looking for approval for that.
Could I get a motion on that?
So moved.
Got a motion by Commissioner Wincher, seconded by Commissioner Lemire. Is there any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right, thank you.
Thank
That's
you.
it for land
Easy
services.
Why is there six on the agenda?
Why is there what?
Six on the planning, you're only supposed to be five tops?
Yeah,
We're gonna start maybe about, we're gonna start about 6? 4?
it'd be nice.
Right?
We-
4?
Yeah.
I'm okay
No,
with that.
we had 6 on the agenda because we have, looking at the length of time that we anticipate that they should take, we thought 6 was a doable number of agenda items. So we'll just have to put in a bug in the chairman's ear that we'll need to keep that meeting crack-a-lackin'.
Well, one thing about that, though, is we don't need to redo the whole thing on each one. If we do it
Yes,
once.
so I planned my staff report, because we have 3 almost identical requests. So what I'll do with those is I'm just gonna fill in the individual details for those, and so I'll shorten up my part too. so.
Right, okay, thank you very
Yes.
much.
All right.
Thank you, Miss Amy.
All right, auditors report.
Okay, I think we have the trail agreements up first. Mr. Chair?
Yes, you do.
Do we gotta read through this, or?
This is an ongoing agreement that we've had with them for years.
and it does what?
I don't have it in front of me. I
Oh,
gave you the
it-
copy, I'm sorry. This is our agreement with them for the funding and the
Them
pass-through
meaning-
with the
Morrison
Trail
County-
Association.
Morrison County Trail
I
Association.
should have kept that form, sorry.
Well, this is the agreement we have with the group for what they do and how we funnel the money down.
Yes,
Money, we're
the
just a
money comes
pass-through.
through us, we are the sponsor.
Yeah.
Yes.
So they maintain the trails
Sure.
and, they do an excellent job. And we pass the funds through to them, so.
So moved.
Second.
Okay, we have a motion by Commissioner Jelinski, seconded by Commissioner Johnson. Is there any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
I apologize.
Thank you on that one.
We have,
We have the trail agreement that goes
Okay.
along with the funding that funnels through us.
So-
That needs to be moved on to?
Yes.
yes,
Could we get a motion on the?
So moved.
We
on
got
the
a motion
trail
by
agreement.
Commissioner Wincher, seconded by
Second.
Commissioner Lemire. Is there any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries. Thank you. This is the agreement between the Morrison County,
And the
the
trail.
Trail Association, yep. Thank you.
Yep, thank you, commissioners. And next,
Which one did I get?
okay. Amy, if you wanna come up and join me?
Property tax.
You want Joe up too? Yeah, you might as well come up since you're here.
Joe doesn't visit us on.
He doesn't get to come here very often at all.
So we have something new. The Department of Revenue went out and did several listening sessions during 2015, and they met with all of the different associations around the state. And they asked what they could do for us and what we could do for them, and basically went back and powwowed themselves and tried to figure out how we could help them and how they could help us, since so many of the things that we do are interdependent. So everything that we do for the income taxes and the whole property taxation and all the assessment functions, they're all so interrelated that what we do depends on them and what they do depends on us. So what they came up with was a series of items that they decided to track for a year and then relate back to us what they figured out, either what we're doing well or what we're not doing well. And these are, some of these functions are county functions and other functions are Department of Revenue functions. And then the idea is that they'll come back and they'll sit down with us and discuss these things. They may further evaluate these same functions for this next year, for 2017, or they may add or change up and put some more in here, depending on how their discussions with counties are going. So as far as this particular report went, I thought the county did rather well. They compared Morrison County results to the targets that they had set based on statute and deadlines that they had set. And they also compared us to statewide results, how other counties did.
So this was just really kind of a baseline look at really all of our program and what's laid out for us and then they also reviewed themselves on what they're obligated to do for us. And so this really was just a baseline report, I guess, for talking when the DOR comes in here at their various times. I mean, we get some visits from the DOR to evaluate whether or not we are adequately assessing the number of parcels that we need to be getting to in a year. And that's called the quintile. Every 5 years, we need to be seeing every parcel at least every 5 years. So this was a
baseline for that. I think if Jean were here, unfortunately she's not, she's at boards today, so she's not able to be here. But I know we took a look at that, and there were some things that we certainly had acknowledged right away when Land Services came together that we knew we needed to either improve on or build some more capacity in the office. So I don't think any of this really was a surprise to us. And I'm not taking this as being that we are deficient really in any way. And that's been really backed up by Department of Revenue feedback that we've gotten during this transition period. They really dug into every facet of the assessment program, and so we're feeling good about it.
Is there anything that you see, Joe, as kind of the guy who runs the tax program that either struck you as unusual or certain goals that you've established since then, or what are your thoughts?
No, what I took out of this was like our reporting of abstracts to the state, and that we're on time, and that's kind of the main things. That we're on time. There's just a few things where, like tax calculation certification, we're all certified, or we have that covered. It's required once every 4 years. We have to have at least one person certified to do the tax clerk's calc exam, so that we can explain to taxpayers if they have a question on how to calculate taxes.
Is that through the DOR? That
Yeah.
Yeah, so I overall I thought it looked really good.
Is the DOR's intent? Oh, I just did something on what it's going to be, so we're not looking at what it was. The DOR, is their intent to do it all the time, or what's the goal with that?
This will be an annual report.
Yeah,
Okay.
this report is intended to come out annually, and like I said, they may change up what they report based on the feedback they get from the counties and when they come out and talk to us. I think it's a good first start, and we can kind of see how we're doing, they can see how they're doing. Overall, I thought we did really well on these. Nothing that we need to be overly concerned about. And throwing the PRISM project, which Joe can speak to in here, they're kind of redoing the whole tax system, so that everybody reports on one state tax system, throwing that into the mix at the same time as they're doing this report. And we're still meeting all of our targets. I think that really says something, so.
If I may, Mr. Chairman, throw a question on tonight, I don't understand it. You have Morrison County results, it says 32.6 days
Where are you
for the
saying?
finalization under the department. Statewide results is 4.7, so. 14.7. So it takes 32.6 days for us to get back to them?
No, that's the state now down at the bottom.
Yes,
Oh,
so
that's the
it took the
state.
state 32 days to get back
Okay,
to
but
us,
I'm-
and
okay,
statewide, they
But it says
usually-
Morrison County results, that's why I'm looking at.
So that's
Yep.
what they're offering us, or what they're
Okay,
giving
so
us, and they've
the
taken
light
longer
came on.
with us than how they average statewide.
Okay.
The bottom section is DOR.
Good question, because that don't look that way.
Yeah, no, the bottom section is how they're doing, on their part. The top section is how we're doing on what we're doing. So you can see
So it's
they've
kind of
made
a
2 visits.
self-evaluation
Yeah,
as
It
well.
makes sense now.
Yeah, and
So the way that we're gonna really see the full picture of this is a year from now, when they allegedly
is-
do this again.
Right, and this
Right.
is just the baseline results, and some of these, if you'll notice, there really isn't a target, it's just, I mean, there is no requirement, they're just saying, this is how you compare to statewide. So, for example, if you look at the assessor staffing levels, parcels per assessor, there's no requirement of how many parcels an assessor is assigned, but you can see where our appraisers are at versus the statewide results. And that's just really for comparison's sake. It's really not anything to improve or on. It's just information that's the parameters that they decided they would take a look at us.
Perhaps they'll hone the report that is
Exactly.
resulting from
They'll
this
find out
as-
maybe
yeah.
what's working, what's not working, how to read it, maybe, first attempt is always one of those you can always learn from. And I think, this is a great step because I think one of our concerns was the communication from the DOR to the county, not the county assessor, but the county on what issues might be. where we're falling short, where we're doing really well. I think this is the first communication we've seen, and that's why we wanted to bring this to you, so you have a baseline idea as well. So this is not just an internal document. We want to make sure that you are aware of what our activity is with the DOR and how we're doing.
Thank you.
Good deal.
So unless you have questions, I
Yes,
think
and
that's all. We
have-
just wanted to make you aware that this
Right.
report is here and what they're looking at.
You just don't want to sit here and look at us for a while.
Yeah.
Does anybody have any other questions? If not, thank you very much.
Okay,
Thank you.
Should we do the,
Warrants would be.
yeah, let's do the
Yep.
warrants
I
and
would
stuff
so
right
move
away.
on the warrants, all of
Okay,
them.
we have a motion.
Second.
We got a motion by Commissioner Johnson, seconded by Commissioner Wincher. This is a roll call vote. Commissioner Lemire.
Aye.
Commissioner Wincher.
Aye.
Commissioner Jelinski.
Aye.
Commissioner Johnson.
Aye.
And aye.
Thank you very much.
Okay, Mr. Chair, if I could recommend us move to just Public Works quick, I believe Steve has a quick update, and then MCIT representative is here, so if that's all
That would be-
right.
That would be just fine.
That would be wonderful.
I had here auditor treasurer resolution approving sponsorship of,
That was the very first one. That was the
that we
trailer,
did that.
yeah.
Oh, that was a trail, okay, thank you. Just seeing if we're missing
Yep, no,
anything.
good
Good morning
question.
again, Steve.
We're trying a new process, so
Good to
it's
see you
hard to-
guys.
Hi, Steve.
I mean it.
You look
Mr.
like you
Chairman,
mean it.
members of the board, I would like to set up a planning meeting with Public Works in the next couple of weeks, if that would be at
In the
all
next couple
possible.
of weeks.
Yes.
Where are we at? The 8th. So what day are you looking at? Fridays, Monday?
What if we do the 22nd?
I'm open in the morning.
22nd, we got planning and zoning in the evening, that's 2 weeks from last night. Yeah.
22nd in the
Monday.
morning?
It's good with
8:30?
me? Okay.
8:30?
That's good with you guys?
8:30 AM, Public Works, 22nd.
8:30, yeah, 8:30.
And just a quick update, we do have some of our contractors starting up. Our striping work is going to be taking place next week. So you'll see that happening throughout the county. It'll go fast, it always does. Our own staff are completing up on crack sealing operations that we're going to conduct. We do continue to do some crack sealing operations with private contractors. Part of that is because of routing. We typically use private contractors where we route the cracks and then seal them. We use our own forces where we are able to just blow them out and then seal them with material ourselves. Also, our Durapatch, that work is taking place. So you'll see these contractors out and about the county.
What's Durapatch versus,
Durapatch is an oil with a granite chip. Typically, the cracks have sort of collapsed more where you're using Durapatch compared to where you're sealing the crack to keep water out so that doesn't happen as
Okay.
fast.
you're filling that in like?
We're
and then
filling that
sealing it over the
indentation
top?
in so that
Okay.
it rides, you get a ride back into it.
Thank you.
July is when our project Cedar Lake is scheduled to begin. It looks like that's going to all be on track. We have opened bids for our 45 project. We're not ready to recommend to the board award yet. We may need to talk to certain commissioners about helping us with the Corps of Engineers on the permitting. So that is still being held up on the 45 project. We have one last bid that is going to be advertised. That's going to be County Road 268, bridge replacement on 268. We're also including that Lee granite structure replacement and PV Lake gravel where state park account funds are going to be utilized. So that is going to be moving forward, and then also the parking lot would be the other one that we'll be involved with here shortly.
Is 260, is that culvert on 268?
Yes.
That's the one up by PV?
Oh, no, those are two different roads, two different projects.
Two different things, okay.
Yes.
All right, thank you.
So those activities, it all is going to take off here pretty
I
soon.
just want to make it known, it's not just other people. I see the counties out there too. Matter of fact, they're going with their backhoe with a culvert. The other day, they were on the bridge. So you, counties out there too, so you'll be aware of them too.
Restrictions are off, so everybody's trying to get their work done.
Right.
Everything's moving on forward.
Thank you very much. We'll
Thanks,
see
Steve.
you later.
Okay,
Steve,
thank
I'll
you,
give you a
Steve.
call later on.
Okay,
Today.
very good.
Okay, thank you.
MCAT now, Mr. Chair.
Okay, now we'll go back up to MCIT report.
Thank you.
Thank you.
No problem. Thank you for
Steve, if
making
you
it.
wanna come up too, you're more than welcome to.
Deb,
Why
you have
wouldn't
some-
ya?
Deb, you have something there to hand?
Oh, thanks, Randy.
Stay away from as many people.
Are you cold?
Not
cold, but
allergies.
We sound very similar then.
The trees just gotta stop blowing that stuff off of them. It might be
If you
all
would
right.
introduce yourself, James. so that
Good
everybody
morning.
knows.
I apologize for being late. I was in Wadena County this morning, and we ran a little bit late up there. I'm Jane Henniger with MCIT, and I am the risk management consultant with MCIT for Morrison County. Have been for a while. And this is our 2017 report to our county boards. It's basically to keep you up to date on what's happening with your program. And I always have to start with this. MCIT is not an insurance company. What we are is a joint powers entity. Back in the late 70s, counties found it difficult, if not impossible, to get workers' compensation coverage. So some commissioners got together at an AMC meeting and said, why don't we just pool our dollars and pay our own claims? And you established MCIT. The work comp piece was successful, so you added the property, the liability, and the auto pieces to the package. And then as time went on, you said, well, you know, simply paying claims is really not enough. We'd really like some help with preventing those losses from happening in the first place, and then managing risk. Managing risk is sort of, well, if you're going to get into something new, you'd call MCIT and say, well, are other counties doing this? What kind of issues are they running into? Do we have some exposures there? So that's kind of the risk management piece.
So, excuse me,
Mm-hmm.
Mr. Chair, can you explain to me, Jane, you pay out on what, workers' comp pays out on what? Is that,
Well,
Is that fair?
workers' comp is one section.
yep,
And then the other section is the property casualty piece. And that's the property, buildings, contents, property in the open, your equipment,
Okay.
inland marine stuff.
that's the stuff that you're doing.
That we do both. We do the workers' compensation and we do,
We pay premiums.
you
They
pay,
go into the pool, haul the pool, and then claims are paid out of that.
Out of MCIT.
yes,
So what about workers' comp over here?
same thing.
Same thing.
That is-
We pay work comp premiums just like any company would.
So
We pay
workers'
into the
comp goes
pool.
through MCIT?
Yes.
Yes.
Okay, very
All
good.
of it.
Self-insured.
Got it.
Yes, yeah,
Goes through-
self-insured.
Goes through MCIT.
That's why she said she's not an insurance company.
Yep,
Right.
yep.
And 81 of Minnesota's 87 counties participate. I can't name the 81 that do, I can name the 6 that don't.
Okay.
They're Hennepin, Anoka, Dakota, Olmsted, and St. Louis. And back when MCIT was formed, when commissioners founded MCIT, they were large enough that they could self-insure for their workers' compensation piece, and then they just brought their package, the other coverages along with that. Okay, on page 2, down at the bottom, it talks about some of the benefits of pooling. And as you can see from the report, there's a lot of words in there. I'm not going to read them all. I'll just touch on some of the important things. Some important developments with MCIT. We are bringing all services in-house. Our staff will increase from 37 to about 50. In the past, we've contracted services, and a lot of those have been with Meadowbrook Insurance Group. And as time's gone on, we've brought some of those in. The workers' compensation claims piece is now administered by MCIT employees. I was originally a Meadowbrook employee, and they brought the risk management piece in 2010. Loss control was brought in. So the only two remaining pieces are the customer service, the policy or coverage document issuance and changes and certificates are done by Meadowbrook, and then the property and liability claims staff are currently Meadowbrook. So this should be seamless from your perspective. We're doing a computer conversion, of course, but in the end, what you should see is increased efficiency and reduced operational expenses. Another thing that we do is monitor the risks and exposures that counties are having and as they change. A couple of years ago, we added a data compromise endorsement to the coverage package. And what that does is cover the expenses that the county would incur if you had a data breach. We had the opportunity to expand on that. Hartford actually underwrites it, but it's included in your package. So if you had a data breach, you'd still report it to MCIT. But it's a 4-part coverage now, with $50,000 for each section, which is defined a little more in the handout. 2 are first party, so 2 cover county expenses that you would incur if you had a data breach, and the other 2 are third party liability pieces. But also what you get as part of that is access to Hartford's staff, and they have a whole staff of data breach experts. So if you suspect that you've had a loss, be sure to call the claims staff and we'll get you in touch with those folks.
Have we had any of those claims yet within our system? Within MCIT, not us, but within MCIT?
The ones that I'm aware of have been small. And it doesn't necessarily have to be an electronic data breach. It could be leaving a file out, having a laptop stolen from a car, those kinds of things.
MCIT has covered the liability that came with the searching, the data, the inquiries.
The DPPA claims?
Yes, there you go, thank you, I couldn't come up with the acronym.
Yes, and that we did as a liability coverage.
Okay, and not as a data breach coverage, okay.
Right.
But I think Joe was concerned about, with this coverage, that if we had a hack and we got held for ransom, that 50,000 may not seem like a lot. It may cost us more than the 50,000.
And
So this was I think this is a base start for MCIT because it's new, and I'm sure as any other policy we've had, they've expanded them as needed and taken a look at them. So.
Do we have a reinsurance on this, or don't we?
Well, Hartford basically is the reinsurer,
Okay.
but they actually take it from $1 up to the $50,000 limit, so it's a total of $200,000. And as they get more comfortable with counties and county exposures, they may look to increase that coverage amount. So it's included in your package, but after your deductible, it's all paid by Hartford. So we did kind of a group purchasing, if you will.
But we do have reinsurance on our other
Everything
pools for
else.
liability and comp.
On page 3, we take a look at property and casualty claims, and again, casualty is liability and auto. And the top chart there is frequency. Those are the claims that we see the most often. And the bottom is the severity, and that's the expensive, or the
Help me
dollars.
out here. Land use defense, what is that used for?
You can get involved in a land use issue on for example, a conditional use permit, where someone may disagree and take the board to court over that issue. I don't know if you've had them.
We've had these, this is fairly new in the last 10 years. They never used to cover these disputes, and we were paying the brunt. Our county attorney would have to cover these. Now we have coverage, and I bet you we have at least a couple of years, seems like the last few, that we have these going on. So it's not unusual that people disputing land decisions that are made, not happy, we just file
The
them.
MCIT would foot the bill on that, or?
The defense.
Defense.
We have a
Yes.
$2,500 deductible on those claims right now.
So auto is the most frequent. Odds are if you're going to have a claim, it's probably going to be an auto. But also the odds are they're not that expensive, so it'll probably be a less expensive claim. Whereas the public employee liability is less likely to have a claim, but if you do have one, it's probably going to be expensive. Those claims typically go to federal court, and so they're bypassing your statutory immunities and caps on damages. And the types of claims there are wrongful termination, discrimination, harassment, so employment-related stuff, violations of the DPPA Act, that's where those claims are handled, and inmate deaths, suicides, and then the land use also falls under that coverage section. So they represent 11%, only 11% of the total number of claims that we see, but they represent 27%. We used to call that public officials liability, but it sounded like it only covered claims against the board. So we changed the name of it to public employees.
Employees are our greatest asset, they're also our greatest liability.
Yes, we are. On page 4, we look at workers' compensation. And here, when the frequency is on the left, severity is on the right. Here, though, we're not going to see that discrepancy between frequency and severity. Number 1 is sheriff and jail operations from a work comp perspective, both frequency and severity. They represent 32% by frequency and 40% by severity. Highway follows with 18% by frequency and 22% by severity. So nearly 50% by frequency between those two areas, and more than 50% by severity. So more than 50% of the dollars paid out in workers' compensation claims go in those two areas. I was somewhat surprised when we started putting the claims data together for the report, the number of slip and fall claims that are resulting in workers' compensation injuries. I always kind of thought of slip and falls as being the general public, but we're having claims for people getting on, the highway folks climbing on and off of the equipment, even going to your cars or slipping on water in the hallway, and it's employees more than the general public. So we're from a loss control perspective, we're working on that, and also the law enforcement. We're getting a lot of claims coming out of use of force training. So the deputies are being trained in use of force and getting injured in the training. So we're working on preventing and reducing that type of injury. Then down at the bottom of the page, I think that insurance folks like big names for things. That's your workers' compensation experience modification factor. How's that for a mouthful? Just to put it simply, workers' compensation coverage is the only coverage in the trust that's experience rated. And so what that means is that counties that have claims pay more for their coverage than counties that don't. On the property, the liability, and the auto side, it'll affect your dividend, and we'll talk about dividends next. But on the workers' compensation side, claims affect what you pay in. So for each dollar of contribution or premium that we collect, the actuary expects to pay out a certain amount in losses. If your losses come in exactly as actuarially expected, that's a mouthful, you pay 100% of the base cost of coverage, and that's the second column there. If your losses come in less than expected, you pay less than the base cost. And if they come in higher than expected, you pay more than the base cost of coverage. And you can see there in 2016, you came in less. But historically, you've been and then in 2017, you're just a touch over expected. But you had a couple of bad years there, 13, 14, and 15. And we do have resources for you. You have loss control people that can come out and meet with your safety folks and look to see if there's a trend, or are they coming from a particular area? Is it just bad luck? Are those claims older, and there's not much we can do about them at this point? And what can we look at going forward? So we'll be happy to work with the county on that if you like.
So if I might interrupt, Mr. Chair, if I may, Jane.
Mm-hmm.
Sheriff's Office, use of force, what are you looking at? Are you looking at bringing somebody from MCIT in to see that you're being too rough, that you're training wrong? How would you fix, that's kind of what I heard you say. Anyway.
Yes.
How would you fix that?
We've hired a loss control representative with a law enforcement background. And he's been out and about around the state, meeting with the sheriffs just kind of as an introductory session initially, and to talk about where some claims are coming from. But eventually, as time goes on, his main focus will be on use of force training, and it'll be more a kind of a train the trainer. Here's when you need to step in and say, okay, this is getting a little too rough.
Okay.
You know,
That's
yeah,
fine.
yeah, maybe we need to step back.
That person won't be the one attending use of force training in XYZ county. That person will be teaching someone from XYZ county to be the trainer.
Yeah, or both.
Or both.
Yeah.
Okay, very good.
Yeah,
Thank
he
you.
could,
Chair,
he
it
could
is a
also.
tough thing that we've talked about just locally at our level in terms of how do you prepare employees for situations that they may
Absolutely.
encounter, yet not cause difficulty
Yep.
while you're preparing. So it's a difficult balancing act that I know certainly we're open to discussing and talking about what can we do better.
And I could say that most of this rating increase is due to injuries from this
Right.
A lot of
this
it.
Use of force
situation.
training.
Okay.
And
Very-
we need,
very
and we
good.
need to work on that somehow. I mean,
Yes,
you can't
exactly.
You can't just keep allowing it to happen.
There's a requirement there that they are able to take care of themselves, and if they're
Yep.
not trained.
Yep, absolutely.
It's
Very
a
good.
bugger.
You answered
Okay.
it for me, thank you.
And Morrison County is not unique in that, obviously, or we wouldn't have hired someone, so it's across the board.
Right.
On page 5, rates, our rates have gone down in 15, 16, and 17. In 14, we saw a little blip there and rates went up. From a property casualty perspective, we were getting a lot of property claims from storms. And it was also when the DPPA claims first hit, and we had to reserve for those. And we've been pretty successful in defending those and in getting them dismissed, in particular in the statute of limitations area. Down at the bottom of the page, we talk about reinsurance, and I know that came up. So in essence, as a pool, what you do is you pay the first amount of the claim, and it's right in the $500,000 area for most, coverage a little bit higher in workers' comp. And then you place reinsurance coverage on top of that to protect your pool balance from those catastrophic losses. So from a work comp perspective, reinsurance is monopolistic. We can only purchase it through the WCRA in Minnesota, the Work Comp Reinsurers Association. Liability and property, we market every year to make sure that we're getting the best pricing and coverage. We saw a slight increase on the casualty side, the liability and the auto side, and that was due to expectations that defense costs for the remaining DPPA claims will be significant or could be significant, as well as the growth in jail-related claims. We're seeing a lot of claims coming out of the jail. From a property perspective, we kept our reinsurance with Travelers for quite a few years. But this year, Hartford came in with a significant reduction. So we did switch, and it saved the trust in excess of $200,000 by doing so. And then the last area that we talk about is dividends. Dividends are the result of investment income and better than expected loss ratios or losses. We are, I guess probably the way to say it is the board is running a leaner balance than they had before. You're still fully funded and you'd have no reason to be concerned about that. But they're sending that money back to the counties rather than keeping it in the fund balance. You can see there in 2012, we had significant dividends. That was the result of, we can only invest in the same things that counties can invest in as a joint powers entity. And we had bonds, and those bonds matured, and they had a good rate of return. And as we all know, that's a thing of the past. So between the rate reductions, there's probably less money to invest, and we have a lower rate of return on those investments. However, and dividends are never guaranteed, It's when they are actuarially sound and fiscally prudent.
Well done.
Another mouthful. The board will declare a dividend. So it's probably not the most exciting or glamorous way that county boards save taxpayer dollars. But it's the fact that you've remained loyal to the program, that the counties watch their risk management and they've watched their claims, that if you were with a stock insurance company, those dollars go back to the stockholders. Because you're self-funded and because of your dedication to this, those dollars come back here to Morrison County and in essence go back to the taxpayers in Morrison County. So not exactly the most exciting way of saving taxpayer dollars, but in 2016 it was $149,000.
If I may, Steve, where does that money go? The 149, does that go into the general or what?
It's a general fund and it's
Okay.
it's used to offset the county levy, is what it amounts to.
We do encourage counties, if they can, to take at least a percentage of that and reinvest in risk management and safety and loss control. And different counties handle it differently.
If we get more than what I budget for, or what I anticipate maybe, and I'm always pretty conservative on this number, but like in 2012, when we got that 280,000, we were only budgeting 140. So then that got reallocated to not only the general fund, but we allocated it to the highway, social service parks for their share of the things that they had to. So anything over what we budget for, I usually reallocate to others that also pay the insurance.
Okay. Then on 6 and 7, that's the last part of the services, or the services that I mentioned. From a loss control perspective, the Loss Control Department put together best practices guides for public works, solid waste, and park and rec. And those have been distributed to the department heads in those areas. We just got notified that we won an award for that program from Prima Public Risk Managers Association. Step Wisely is a program that we adopted a couple of years ago, and that's to help prevent those slip and fall claims that I mentioned. And then we talked about the biggest change that we have, and that's hiring the law enforcement loss control person. As last I heard, he had not yet been able to meet with your sheriff, but he's been working on it, trying to get together with him. From a risk management perspective, we're continuing to do the things that we typically do. We'll work with you on reviewing contracts from a risk management perspective. We answer the coverage questions that you may have, and we'll also work with you on the risk management issues if you're looking to do something and want to know what the risks are. Another area that we're working on is putting together like mini webinars, so that if staff has a question about something and we're on the road or out of the office, you can just go to our website and look it up and get a quick answer.
I was thinking too that, I know you try to come into the counties and do these presentations, and sometimes trying to get everyone together. I'm thinking that more of a web base where they could just go to it anytime they want would work better in our situation, or it seems like it would, because it seems like our participation isn't always the best for those types of things. So my suggestion would be to do more of those and have it videoed so that when people do want to get to it because they can't make it to a day that we select, they can get access to it. And that's just.
And that's kind of the direction we're going.
I think that's a good direction, because it's always so hard to get a meeting where everyone can make it to these things.
Right. Patrol is a very cost-effective way to get post credits or law enforcement continuing education credits, and you do participate in that. Employee assistance program, we look at that from a risk management perspective rather than sort of a health insurance perspective, because there's a direct correlation between employee personal issues and accidents. It offers up to 4 free counseling sessions for employees and their family members. A couple of years ago, Sand Creek is the administrator, and they came out and did resilience training. And it's a 1-hour session for all employees, and then another session in addition to that for supervisors. It was really well received, so they're offering that again, Resilience 2 in 2017. and we encourage you to take advantage of that. In September, we'll be offering kind of a follow-up to the new commissioner training that AMC does. And anybody that remembers their first year as a commissioner knows how much is thrown at you in those first few months. So we're waiting until our newly elected commissioners get their feet on the ground a little bit. And you've worked with some of those things that they talk about, but it's not only newly elected, it's open to anyone. So on September 6th, in our building in St. Paul, we'll be offering Balancing Leadership and Risk While Serving the Public. Defensive driver training, we like to see you take advantage of that at least every other year or every 2 years. We offer it 2 ways, on-site. If we come on-site, it's someone that's been with the Minnesota Safety Council for more than 25 years, typically a retired highway patrol person. And then there's 3 areas. There's private passenger autos, buses, and heavy trucks. The other is an online thing where we give you so many licenses and they can access it on their own. Additional resources are statewide training seminars. In May, we'll be doing, these are in St. Cloud, and we'll be doing conducting employee investigations. And then in September, later in September, we'll be doing land use again.
Okay.
They do offer some good trainings through MCIT. They're usually quite cost effective for us because most of them are in St. Cloud, which is great. I mean, we can send staff, so they do a good job of getting high quality folks out there in front of people. Appreciate that.
Thank you. So that concludes the report, and Robin Sykes always gives me a hard time about the way I end it. She says it's sounding like we're coming in for a landing, but it's sincere. On behalf of the MCIT Board of Directors and your MCIT service team, I'd like to extend our thanks to Morrison County for your continued participation.
Thank you. This is a
Thank
very
you.
thorough report.
Thank you very kindly.
Yes, thank
And
you.
again, I apologize for being late.
No problem.
Done.
Sometimes those county boards, don't like.
Yeah,
Wadena.
Wadena.
It's a guess.
You were in Wadena?
Yes.
Bill Stern must have been talking a lot then.
Actually, kind of wanted to review the property schedule, so.
She wanted to start at this county, but I said, no, go start at another
There
county.
you go. There you go.
Okay, thank you very much.
Thank you very much.
Thank you.
Okay, administrators report.
Mr. Chair, I don't have an actual report or any type of action items. Continue to work on the building project's always an everyday component, but things are moving along with that. So as we get more information, we will let you know. I don't know of anything else, though, anything out there that anybody's waiting on or that we need to address at all from my perspective or the office.
Not that I know of.
Okay, well, just let me know, you know where to find me. I've tried to hide, but I can't.
Okay, committee reports and upcoming schedules. Who would like to start with their schedule, or do I need to?
May 14th through May 27th.
Let me see. Jeff, Mr. Jelinski.
May 15th, nothing. May 16th, 8:30 in the morning, we have a planning meeting. At 11 o'clock or thereabouts, we should have a budget meeting that same date. On the 18th at 10 o'clock in the morning, I've got an Armor O&O meeting in Alexandria. At 7:30 that evening, I have an Egg Society meeting, and I think that from now on, they'll be at the fairgrounds until it gets cold. On the 20th, as a matter of information, there's a rock and run at Belle Prairie. That's a yearly thing. On the 21st, as a matter of information, EMS week starts. On the 22nd, at 8:30 in the morning, we should have Public Works Planning Meeting. At 4 o'clock that same afternoon, I've got a Stand Up For You CHI meeting that is gonna be in Rice. And that's gonna be at Shepherd's in the Pines. It's a community forum regarding the drugs and the impact in communities. The 23rd, 9 o'clock in the morning, we have 9 o'clock in the morning, we have County Board. At 5 o'clock that evening, I have a Stand Up For You meeting at the middle school. And that pretty much takes it for me. Thank you.
Commissioner Johnson.
Okay, on the 15th, Commissioner Wilson and I have community development at 12:15 on Tuesday at Pine Country.
Just a second, hold it. You said the 15th, right?
16th.
You said-
16th.
Okay, you said 15th, right?
Oh.
Yep, okay, 16th. Yep.
16th on Tuesday, community development at 12:15 at Pine Country. On the 19th, I have Mississippi Headwaters Board in Walker at 10 o'clock in the morning. I think Commissioner Jelinski did say planning and zoning on the 22nd, right?
Yeah,
Okay,
Planning and zoning or public works?
yeah, well, we got both.
We have planning commission.
commission.
Planning
I
Commission,
did not say that. I'm
Planning
sorry.
Commission
Thank
at
you.
7 o'clock at night.
Thank you.
On the 22nd, I have, at 6 o'clock on Thursday, the 25th, I have Region 5 at Joint Powers and Staples. That's it for me.
I've got Airport Commission on the 18th at noon. And that's it for me. Hasn't been said. Mr. Lemire?
15th, Community Health Needs Assessment at St. Gabriel's Hospital. 18th, 12:15. 18th, TCC, 5 p.m. And 24th, Public Health, 5 p.m.
Okay.
And myself, on the 16th, I have a Great River meeting at 5 o'clock in St. Cloud, Great River Regional Library. And then on the 25th, I have Soil and Water at 9 o'clock. Otherwise, the rest were mentioned.
Okay, if there's nothing else, can I get a motion to adjourn?
So moved.
Second.
Motion by Commissioner Johnson, seconded by Commissioner Wincher. All in favor signify by saying aye.
Aye.
Opposed? Thank you very much.